Good morning, honorable members, our new Minister of Agriculture, the DG, and your team, our guests, MECs and HODs present here today. You are welcome. Honorable members of the Portfolio Committee, you are welcome to this first Portfolio Committee of the third term of Parliament. I believe we all worked hard during the constituency period in trying to respond to the needs of our communities. On behalf of the Portfolio Committee on Agriculture, it is my distinct honor and privilege to extend our warmest congratulations on your appointment as the Minister of Agriculture, Honorable Ocamp. As the Portfolio Committee, we are pleased to welcome you back, Honorable Minister, in the agricultural sector. Hence, prior to your appointment as the Minister of Forestry, Fisheries and Environment, you served in the Portfolio Committee on Agriculture. Your appointment comes at a critical time for South Africa's agricultural sector. Agriculture remains central to our country's food security, rural development, job creation, economic growth, and transformation. The committee is confident that your leadership will contribute meaningfully to advancing these national priorities. As the Portfolio Committee, we reaffirm our constitutional mandate to exercise oversight over the executive in a manner that is constructive. We want to assure you that we are not going to be destructive. Our procedure is going to be fair, aimed at improving service delivery for all South Africans. We look forward to working with you and the department in a spirit of mutual respect, accountability, as well as cooperation. The committee remains committed to supporting initiatives that promote inclusive growth, strengthening food security, create sustainable employment, and improve the livelihood of our rural communities. We believe that through collaboration, transparency, and a shared commitment to the people of South Africa, we can collectively advance the objectives of the Government of National Unity and the country's broader developmental agenda. Honorable Minister, we wish you strength, wisdom, and success as you embark on this important national responsibility. Be assured of the committee's commitment to engaging robust but constructively in pursuit of a thriving and transformed agricultural sector. We recognize that you assume this responsibility amidst significant challenges, including strengthening biosecurity, combating animal disease such as foot and mouth disease. These challenges also present opportunities to build a more inclusive, competitive, and resilient agricultural sector. Once again, congratulations on your appointment, and we look forward to a productive working relationship with you. Honorable members and our guests, today we are meeting to receive a briefing by the MECs for agriculture on foot and mouth disease interventions and implementation of the FMD vaccination program in the provinces. Today we'll receive the presentations from five provinces. We are going to start with Free State this morning, MEC. It is going to be followed by Mpumalanga, then Limpopo. Then in the afternoon, we are going to receive a briefing from Northwestern Gauteng. We are going to have a second leg of our exercise. Tomorrow, we are also receiving briefing from Northern Cape, Eastern Cape, as well as KwaZulu-Natal and the Western Cape. With those welcoming remarks, Minister, I'm going then to hand over to Albertina to take us through apologies, but get ready to introduce your team and end. Thank you.
Thank you, Chair. Good morning, Chair. Good morning, members. Good morning, Minister, DGs, our guests and colleagues. Chair, we've got apologies today from MP Davids. MP Davids is off sick, and MP Madlala is also off sick. MP Mkongi due to party work, and MP Sikwati is attending Standing Committee on Finance, and MP Iris also due to party work. And the Chair, Minister requested to be excused early around 11 o'clock today, Chair, according to the correspondence that I share with you. Thank you, Chair.
Thank you, Albertina. I'm going to then request honorable members to just introduce themselves so that our MECs, together with the minister, they are going to know who are they interacting with. My name is Nobuhle Nkabane. I'm the Deputy Chief Whip. I'm just serving here as an acting chairperson for just a short period of time. Once the decision has been taken, then a new chairperson is going to take over.
Good morning, Chair. Good morning, everyone. Nomasonto Mutaung, a member in the portfolio Justice and Constitutional Development. I'm a member in the Agriculture today. Thank you.
Morning, Chairperson, and good morning, goeiemôre almal. I'm Desiree van der Walt, a proud member of the committee now, and from Limpopo Province.
Good morning, Chair, and good morning, Minister. You're welcome. Welcome back to your committee. My name is Nandine Dalane from Limpopo. I'm happy today to see my MEC. She just joined us. Thank you. I'm a member of the committee.
Oh, good morning, everybody. My name is Andile Mutama. Thank you.
Good morning. My name is Zwelakhe Mthethwa, original from KZN. Welcome back, Minister. You know us. Thank you.
Good morning, Chair, honourable members of the committee, and the Minister and the team from Agriculture. Cebekulu Tsigayezo, thank you.
Okay, I'm going to then hand over to the minister to introduce your team together with our guests for today. And then you can just do an overview, then you hand over to a relevant, to the MEC of Agriculture from Free State to take us through the presentation. Thank you.
Thank you very much, Madam Chairperson. Let me just introduce my team. I've got my Director General for the Department of Agriculture, Mr. Moketsa Ramasodi, as well as Mrs. Kwena Mukape, DDG, Dr. Emily Mokhajane, and I think, who else are you from our department? Alicia, sorry, I forgot your name for a moment there. Alicia, what's your name? Alicia Stevenson. I will remember all the names in due course. That is it from Department of Agriculture. Anybody else here?
Yes, and we have got an apology from Mr.
Okay. Chairperson, DDG Serrage, there's an apology. He's got a bereavement that he's got to attend to. So that is it from the Department of Agriculture. Chairperson, thank you very much for the warming, welcoming words. I think today I feel like a student in school that went to another school and then came back and see all your old friends again that you've missed so much. I've served on this portfolio committee as a member since 2024, and I must say that we really had good relationships with each other because we worked together to the benefit of agriculture. We went on oversight trips and on places in the Eastern Cape and other places in the country where we've witnessed what the shortcomings are and collectively try to see how we can change that to the benefit of each farmer, whether it's an upcoming farmer, emerging, or a commercial farmer, it doesn't matter. We are working in the best interest of agriculture. When I walked in here this morning and I saw the administration staff, my heart was warm again to see you guys. It's been such a privilege to work with you in the past, and I'm really looking forward to working with you going forward now as well. Madam Chairperson, the mere fact that one had good relationships with each other does not take away the responsibility of this committee to do oversight over the executive. And my aim and my prayers will be that we will always handle each other respectfully and with one aim in mind, and that is to benefit agriculture in our country. Agriculture is looking after the food on our tables every day. Food security in this country is a very important thing for everybody. And we must ask ourselves in this committee, me as the minister and my department, as well as every member in this committee that's doing oversight over us, are that we are doing contributing to safe production of food in this country? And are we protecting our farmers? I give you my commitment that I will go out and do that every day. Good morning, Mr. Trollop. It's good to see you again. I was wondering where Ethel is. Ethel, Honourable Trollop, when I see him, I remember one evening at a town there in the Eastern Cape. I can't remember the town's name, but where we were quite entertained by a number of people that sit here today. And Fort Beaufort, that's correct. So Chairperson, the bottom line is that although we might have good relationships with each other, and although in some instances we are friends, there's an obligation on this committee to do proper oversight over the work that me and the department does. And I would expect nothing less. But I would also expect that happens in respect for each other mutually, and that is exactly what you will also get from me and my department. Chairperson, let me come to the topic at hand. It has now been a month and 5 days since I've been appointed as Minister of Agriculture. It's been a very busy month and 5 days. Luckily, I knew the department because of the fact that I served on the portfolio committee in the past. I knew the entities, I knew which people are where, but still it's a bit, I don't want to use the word overwhelming, but it's a lot to take in, especially with the crisis of foot and mouth disease that we are dealing with. One of the first things that I did is I had to settle the court case that was looming. On the 9th of July, we sat with Sakeliga, SAI, as well as Free State Agriculture. Why the 9th of July? Because on the 10th of July was the last date in which the department had time to file our opposing affidavits should we wanted to turn the interim court order aside. We sat around that table, and the first thing that I realized is that there's not a lot of things that we cannot sort out if we communicate with each other. It does not mean that we will agree on everything, but there where we do not agree, we can communicate with each other what is standing in the way. Why aren't we agreeing? And we managed on the 9th of July to reach a settlement agreement that basically rests on 3 legs. The first one is with regards to the import of vaccines. The private sector, as well as OBP, must be allowed to import vaccines. Government made it clear that not the National Department nor OBP or any entity will insist on any exclusivity rights when it comes to the import of vaccines. I've subsequently had meetings with both DuneVax, that imports the Dolvet vaccine from Turkey, as well as with Biogenesis Bago and the Argentinian ambassador, where I made it clear to both of those groups that government does not insist on exclusivity when it comes to the import of vaccines, and that they can go out and supply it to approved private sector companies that can help us bring this in at scale. When government brings things in, we all know that you've got to go through a procurement process. It takes time. When the private sector buys it and they bring it in, it's much quicker. And it will enable the private sector to then distribute it to their own members, which will open up a parallel form and stream of vaccine availability. So the first one was to say the private sector can go full on ahead to bring in vaccines. That will definitely enable us to receive more vaccines in the country. The second problem that we had was the distribution of vaccines. Vaccines came into the country, but every single vaccine had first to be taken to OBP, to be booked in there. It took time. it created a bottleneck, and it in some instances lengthened the process by weeks. What we have agreed now is that every entity that brings in vaccines that's been approved by SAPRA for having cold storage facilities and the distribution capacity, they can now, straight directly from the airport, distribute those vaccines right to the various veterinarian offices and practices throughout the country. So it does not have to go through OBP again, hence sorting out a huge bottleneck and sorting out, taking away the time that's been eaten out of the process. So now we hopefully getting more vaccines into the country, and secondly, we are distributing it faster. But the third and the big contentious thing was, now it must be applied. In order to sort out a problem, you've got to face reality with regards to what the problem is. And the problem is that we do not have sufficient veterinarians, state or private veterinarians in the country, to, at scale and speed, apply the vaccinations, the vaccines to cattle. And we had to ask ourselves, how can we overcome this? In terms of the law, the authorized person to apply vaccines is the Director for Animal Health in the department. But the law does not end there. The law makes provision for instances where that authority can be delegated. And for purposes of the application of this vaccine, we said that we will trust our farmers. Our farmers vaccinate their animals annually against various diseases. They know how to do that. The law is clear. Any person that wants to become an authorized person must apply. And that application must then be approved. So what we've done is we said that we will deem every farmer that works with cattle as a person that can become an authorized person, should he or she apply. And might I say there that I, in a lot of instances, use the male description he, but I mean she as well. We've got wonderful female farmers in this country, so please don't take the wrong reference if I only use the he. But any farmer that applies will be deemed to be able to do the vaccine. That's the first step. After you've applied to become an authorized person, you must give notice of your intention to vaccinate. On that notice, you must tell us which farm, how many animals, what is the type of vaccine that you're going to use. Will it be a first or a booster vaccine? All the information is available on the online platform. After you've done that, you can go and you can collect the vaccine from the veterinarian that you've ordered it from. You can drive to your farm, you can vaccinate your animals, and then you've got 14 days to report back on the vaccination that you've applied, the vaccines that you've applied. Again, it's all the information is online. The online system has been put in place again to stop things from creating a bottleneck. If every application had to be done by hand and land on the desk of the Director for Animal Health, we would never have been able to sort this out. It would have been thousands upon thousands, and it would have been a problem. The online system that the department has approved is a live system. Anybody that applies, the moment that you've supplied all the information and you press enter, it immediately sends you an email to say, we've received all your information, you are now deemed as an authorized person. But that does not say that you can get vaccines. Now you must give notification of the fact that you want to vaccinate. And the moment that you do that, you must provide the cadastrals of the farm, where the farm is. It must be plotted. We must know exactly where that farm is. We must know how many animals you want to vaccinate. All the information, it is on the online system. We have said that we will allow agricultural organizations. I've had discussions with AFASA, with Agri-SA, with TLU and SAI on this. They will be able to also on their organizational platforms create a link for this application process and report back process to be done on their links. And all of that is integrated with the system that government has got. The reason for that is we are not only applying vaccines to get our cattle disease-free. That is the main objective. But we also would like to get to a point in the future where we can firstly say South Africa is now foot and mouth disease-free. with vaccinations, and hopefully later on to say we are now foot and mouth disease free without vaccinations. And to be able to do that, we need this information to take it to the World Organization for Animal Health and show them what the processes were that we took and what we worked by to get to that point, as well as all the data in that process. But it also helps us in this process to monitor areas that's not been vaccinated properly. You can imagine if you've now plotted on maps where a first and a second vaccination took place, you can clearly see where there are shortcomings and then direct your attention to that. One of the very important reasons why this has happened, government still has got the responsibility to apply vaccinations at places where there's new outbreaks, and especially in places in our rural areas where farmers maybe does not have the money or the means in the form of a kraal or the facilities that they need to do vaccinations. Government must do that still. In the past, government had to run all over the place, to commercial farmers, to feedlots, to rural farmers. With what we've done here, it opens up the private sector's capacity to do this. And this will, in time then, also lead to the fact that government will have more time to spend on those emerging farmers or rural farmers that does not have the facilities or the money. And we will definitely try to see that we assist each and every one of them. Any farmer, irrespective of color in this country, that cannot afford this vaccine will be helped by government to get it. It does not help us to create herd immunities in areas, and we think me and my neighbor and everybody around us are fine, but somewhere there's a farmer that could not get the vaccination, and in 6 months' time the whole herd in that whole area is infected again because we did not stand together as a farming community. What I pick up is that people all over the country, farmers, are willing to assist each other. They're helping people that does not have the means, and they're also helping a lot with biosecurity. On the biosecurity front, Madam Chairperson, it's very important to understand that vaccination is a very small part of this whole fight. We need to make sure that farmers understand the importance of biosecurity. Biosecurity begins on your farm. Biosecurity is not only the government and police and provincial traffic departments and local municipalities traffic departments. It starts at your farm. I attended an auction on Friday and Saturday in Ermelo. When you drive in there, your vehicle's wheels are sprayed. The undercarriage of the car is sprayed. You are asked to step out, walk through a sponge bath so that your feet can get disinfected. That is the type of things that we should do. And that where people cannot do that, government must try to assist them in doing that. Chairperson, the bottom line is we are at a point now where, due to the agreement on imports, I believe that imports will become quicker, and we can see that already with orders. The distribution thereof will definitely be quicker because we've sorted out the bottleneck of OBP. And the application thereof would be quicker because farmers will now be able to vaccinate the animals themselves. I think by doing that, we are now at a point where we will definitely reach our targets and also get booster vaccines in much quicker. That is very important. I can just mention that we have currently up to now received 17 million vaccines. There's another 4 million vaccines arriving next week or later this week. Then during my meeting with the Argentinian ambassador a couple of days ago on Friday, Biogenesis Bago also said that they will up their imports to South Africa or exports to South Africa of vaccines. So I believe that we will have quite a number of vaccines available. I would now like to urge farmers, all farmers, to go onto the system and apply to become an authorized person. We have now opened up that channel. Please make use of that channel. Please make sure that you get the vaccines through the process. Go and vaccinate your animals. We trust you that you are capable of doing that. If you do so, you are alleviating the whole process. It's not necessary for you to pay your veterinarian a fee because you can go and apply that yourself. Whereas in the past, the veterinarian had to go out and it cost farmers money. You can now do it yourself. You do it yourself in any case with lots of other diseases. So we urge farmers to please take part in the system. It will help us a lot to create this whole herd immunity. Thank you, Chairperson.
Thank you so much for providing us with that brief. At least now we have an idea on the affairs of how is the department managing the foot and mouth disease and some of the interventions that you have introduced so far. I was hoping that we are also going to introduce your guests.
Sorry.
Our guests are your
Yes,
guests.
I can do that. Madam Chair, I can definitely do that. I must be honest that most of them are spoken either on Zoom or on the phone with, so I don't know all of the MECs' names, and I will be the first one
just
to
allow
admit it.
them to
I will
just
allow them.
introduce
I know,
themselves, yeah.
I know MEC Rockman right next to me, but I'm going to ask all the MECs just to introduce themselves, please. Thank you very much.
Good morning, Chairperson, honourable members. I'm Elsbeth Rockman. I'm the MEC Agriculture, Rural Development, Environmental Affairs. It's a long story. Free State, thank you.
MEC Rockman, can you please also, when you are introducing yourselves, you must also introduce your technical team that you attended the meeting with, please.
Thanks very much. I'll ask them to just indicate by hand. Next to me is HOD Tsepo Mabelu. And then we have Acting Director, Animal Health, Dr. Jurgens Barnard. He's there at the back. And my Head of Office, Mr. Gerald Medisi, is also with me.
Chairperson, if you would allow me, please. I made a terrible error. I did not recognize the Deputy Minister of Agriculture, Deputy Minister Kappa. Deputy Minister, sorry for that. You are hiding away there. You should actually sit right next to me, but that's fine. Welcome, and I want to publicly thank for all the cooperation and assistance that I've received from her since taking office. It's really been a good relationship, and I'm looking forward on building on that. Thank you, Deputy Minister, and sorry for not seeing you there. Thank you.
DM, you're welcome. Our apologies, we did not see you. You are just hiding somewhere. Maybe we need to sort out the seating arrangement because it's supposed to be here, just next to. Yes, we can just move down. Yeah, let's sort that out, please. MEC Moketsi?
No, thank you very much, Chair. Good morning to yourself, to the Honourable Minister and the Deputy, all honourable members and all officials. Nguketi Wemweketi from Mpumalanga, MEC Agriculture, Rural Development, Land and Environmental Affairs. I'm here with the Chief Director, Dr. Cele, and the Head of the Office, Dr. Mzwake Nkosi, and also Utulane. Thank you very much, Chair.
MEC Kekana, you must be settled and introduce yourself and your team.
Good morning, Chairperson, Minister, Deputy Minister, all MECs present, and the DG and the DDGs, members of the Portfolio Committee. My name is Nakedi Kekana, the MEC Limpopo Province, the food basket of the country.
MEC Sambata.
Good morning, Honorable Chair and Honorable members of the Portfolio Committee, Honorable Minister, Deputy Minister, my colleagues, MECs, DG and the National Department. Madoda Sambata, MEC for Agriculture and Rural Development, Northwest. I'm with the Director of Veterinary Service, but he's not late. He was supposed to be here too. Papa nje that I'm here. I was supposed to be here too. Thank you very much.
Okay, thank you so much for those introductions. I'm going then to hand over to the MEC Rockman, to take us through the presentation.
Thank you very much, Chair. I'm going to try to manage the microphone and the setup to the link simultaneously. Thanks very much for the opportunity, Minister, Deputy Minister, and Chair and members of the committee, as well as all of our senior officials and my colleagues. I think a couple of months ago, the Portfolio Committee was in the Free State. I think you were doing visits to all provinces, so you have an idea where we were at that time and where we are at this stage. I'm happy to say that we are part of the Million Club, that we have vaccinated at least 1 million animals. I think our provinces are doing the best that they can, and obviously under difficult circumstances from time to time and according to the dynamics in different provinces. I'm not going to go through purpose and background. We all by now know what is FMD and the clinical signs, etc. So just to recap, the first FMD outbreak detection was July 2025, just over a year ago, at a commercial farm in the Kroonstad State Vet area. The property was placed under quarantine. We immediately started, and that sort of set the blueprint for how we have been dealing with all of our FMD cases. Mostly cattle is affected. We have had very few cases reported amongst pigs. And then latest reports, there's some FMD recorded in game animals like sable antelope. So the current status at 31st July, our confirmed outbreaks 739, suspect outbreaks 289, closed 492, active outbreaks under quarantine currently 247. Our provincial cattle population is just over 3 million. That's an estimate. And then vaccine doses received, that would be BVI, ARC, as well as by Genesis and Dolvet, is 1.671480 million. Currently vaccinated as at last week Friday's report, 1.4 million. So we are sure to reach 1.5 million by the end of this week. And then the vaccine doses outstanding, but ordered is the 230,000. It's that same 230,000 BVI that we have on order. We heard in MEC last week that it seems that BVI has gone back to production. So we have to take a decision whether we keep waiting for the BVI, which we will do if it is impossible for us to switch an order to another manufacturer. If we cancel that order currently, if it means we are going to lose the money in terms of PFMA processes, we will keep waiting for BVI. We would not risk losing the money on a rollover. So our livestock profile, total cattle population I just mentioned is just over 3 million. Tabu Futsinyani has just over 1 million, and Fezili Derby, that is more than 57% of our cattle are in those two districts of the province. And we are planning to roll out our provincial livestock census during the current financial year. Because our numbers, specifically on commonages, is so unreliable, we thought it is a good initiative for us to have our own provincial livestock census, and obviously it will work together with the National Department, ARC, and other relevant stakeholders. The current outbreak status is, I think that just gives the breakdown that we've referred to earlier. Our capacity currently, resources spent on vaccines 25-26 financial year. It's the 18.1 million outstanding order of BVI. We will still use BVI when it becomes available. We were quite satisfied with the efficacy of the vaccine despite it being water-based. And it has a shorter period within which you must revaccinate. And we paid and received about 2.5 million of vaccine from provincial funds Now for 26/7, the available budget is 5 million from disaster funding, 16 million from CASP. We currently are not giving any consideration of replacement of livestock as a result of FMD. There's no national position on it, and there is also no available budget. Previously, we reported that as the national disaster was declared and classified on 13 February 26 in the Government Gazette, our EXCO subsequently approved our business plan. It was submitted. The request was for 281 million. But sadly, there is no progress since that presentation from the National Disaster Management Centre or National Treasury. We have not even received acknowledgement for that matter, let alone progress. Our human resource capacity for veterinary service, we have 10 state veterinarians with 5 vacancies, 39 AHTs, animal health technicians, 26 vacant. We've appointed 3 with effect from the 1st April, but we've also lost staff due to early retirement. We have 4 support staff and we have 20 AHTs from the DOA has not materialized to date. Those were the learnerships. It's still under consideration by DOA. Then supplemented by about 32 private sector vets at this stage and 8 AHTs seconded by RMIS who work with us, specifically on foot and mouth disease. And then vehicles, we received the 10 additional bakkies that was procured, but it was delivered in April. We are also assisted with transport by Sarnik in Fizili, Derby specifically, Sparta, Welkom, Viljoenskroon, Markwart and Klokkelaan. So our private sector partner contributions are really assisting us. Then the mobile quarantine facilities, we've presented this before, will be deployed along the border of Lesotho, specifically at Menonsa, Ladybrand and Vicksburg. The 4th site is yet to be finalized between Wepener, that falls under Mangoong, and then Zastron under Mokari. Zastron seems to have made more progress in re-establishing pounds. But the Defence Force and SAPS have strongly recommended that it rather be located at Wepener. So it's the 4 mobile quarantine facilities that have been procured and delivered. The first 2 will be deployed at Ladybrand and Vicksburg. Ladybrand, the kit is in municipal storage. OVK is holding one for us in Vicksburg. The remaining 2 are still with Malakai and the university, and then 4 cattle trailers are held in Bloemfontein on a private farm until the mobile quarantine facilities are established and set up. So we're working with, like I indicated, SANDS, SAPS, SARS interestingly has joined that team. Our community safety, roads and transport and COCTA, as well as the 4 affected municipalities and organised agriculture. So they will be deployed and operated in alignment with our pounds and applicable municipal bylaws, but the animal health aspects will be under the supervision of our state vets. And the SLAs with affected municipalities is in the process of being finalised. Mostly the mobile facilities will be set up on municipal land. Then that slide just reflects the provincial outbreak response strategy. I'm not going to spend time there. Our initial priorities are known. It was dairy farms in high and medium risk areas along the interprovincial and Lesotho borders, surrounding buffalo farms and provincial reserves, pig farmers in high risk areas, and vaccinating farms surrounding the pig farms and our hotspot areas. And then additional considerations, I think the Minister has covered that. I'm not going to repeat that as well. Then our concerns regarding the risk-based strategy and the new approach is the lack of consultation regarding the settlement of the court case and third-party reporting systems. I think we can do better to communicate and share information during these processes. There's always the risk of under-reporting of vaccinations. We are concerned that here and there we pick up the link that disease is being hidden. So it's not reported initially. It used to be a strategy to try to get priority amongst vaccinations. It's not the majority of the cases, and quite frankly, the majority of our farmers are cooperative and collaborating very well with us. There will always be pockets that are less cooperative. Let me leave it at that. And then possible impact on export certification. If the state vets must certify that there's no clinical signs of FMD, in the absence of either complete absence of documentation or incomplete vaccination, it may negatively impact the issuing of export certificates. So it's something that we should be aware of and make sure that all the role players really fulfill their responsibilities that they are supposed to. So our vaccination strategy, it is essentially, as we have been outlining, infected areas and surveillance zones, ring vaccination, contact farms vaccination, booster vaccinations that are planned so that it falls within the required timeframes, and the vaccination prioritized according to epidemiological risk assessment. So there is our key achievements. We are continuously vaccinating. We are collaborating well with the National Department. Our cold chain maintenance throughout the campaign is maintained, and we are able to adjust our vaccinations according to the disease spread. So the procurement timeline, the July to October last year was the initial vaccine allocations. November, we received our own provincial procurement that was received. December, we placed the additional order, that's the outstanding one that's not been received. February to July, it's the national procurement from Botswana, Argentina, Turkey, and the ARC. And then our concern that we did raise, and the Minister indicated he will be taking this up, is the OBP price to provinces, what we pay and what we here industry pay, which seems to be, or is reportedly much lower. But as I indicated last week in MEC, the Minister did indicate he will engage with OBP on that matter. So the progress, vaccine doses ordered by the province is 260,000. Vaccine doses is received 1.671480 million from the National Department. Outstanding is that 230 dosages of BVI, and our provincial procurement expenditure was 21.060793 million. Last financial year. Distribution per vaccine type, so Fezili Dabi, Artoprevia 52,000, Bioaftigen 214,000, Aftadol 277,000, ARC 500, that was in Fezili Dabi, Lishveli Putswa 25,000, Artoprevia, Bioaftigen 80,000, Aftadol 180,000, ARC 1,000, Mangung only received Bioaftigen and Aftadol because they were not initially amongst the high-risk areas or high-priority areas. Tamfutsinyani 40,000, the respective categories 40,000, 150,000, 980, 350,000 and 800. And Gharib as Mangung, they were not in the high-risk areas. Initially, they received 50,000 and 70,000 Bioaftigen and Aftadol respectively. The totals, the 117,000 Artoprevia, Bioaftigen 544, 980, Aftadol 977, 200, and ARC 2,300. Per farming system, commercial and communal, the breakdown is given there. I think members that have the presentation, so I'm sure they are familiar now with these numbers. That's currently our vaccination strategy. Aftadol is the green, it looks like diamonds, and then the blue-purple triangle is the biogenesis. That is what the Free State currently looks like when it comes to vaccinations. By district, Thabo Mfutsinyani, we have vaccinated just over 586,000, that's 41% of the total. Fezili Dabi 437,000, that's 30% of the total that needs to be vaccinated. Lishveli Putswa 243,000, 17%. Gharib and Mangung 6% each vaccinated. Then the production system between commercial, communal, feedlot, dairy, smallholding, emerging, and plots and stands. 54% of vaccinations were done by the department, 46% were done by private vets. Provincial cattle population is 3.061, animals vaccinated 1.438, Our coverage currently stands at around 47%. We've really had minimal waste or residual losses. Currently stands at 0.34% of the total vaccines received, which is really minimal. Then the vaccination booster strategy, the national strategy is not yet in place, but we do track. Provincially, we have our own tracking system in place for when booster vaccinations have to be administered. If under quarantine, the commercial farmers are informed they must apply for booster vaccinations already. The booster campaign in Kwakwa is currently being planned. We've had no further positive cases since we've done the 4 to 8 May 26 mass vaccination campaign. I think that happened immediately after the Portfolio Committee's visit. And then 2025 BVI vaccinations, the boosters are applied with Aya Biogenesis and Dolvet, for example, in Sasolburg and Parijs. Our HR and operational capacity, the resources deployed and operational activities are reflected there. Financial resources and infrastructure, it's the 21 million for 25/6. The resources utilized and infrastructure supporting the response, that is indicated. The LIT system, training is received by the core personnel, 2 sessions. We're aligning our data collection with LIT's requirement and then the capturing of data. Our challenges remain additional support staff and additional IT resources that are required. Then our information and awareness campaign, that is continuous and ongoing. We've had quite a number of additional farmers' engagement this year, and it is still standard that we do the FMD presentations during our farmer engagements. Then our key challenges, operational challenges, continued emergence of new outbreaks, including Lesotho. Though vaccinations are allocated by DOA to the SADC countries, vaccination seems not to have been started. And in the Free State, we will not win this battle against FMD if Lesotho does not start vaccinating on their side. So there's a couple of strategies, but I've had an informal conversation with the Minister. I'm sure he can, in his closing remarks, also reflect on that. The high demand for vaccines nationally, it is what it is. It's not going to reduce suddenly. Our limited veterinary personnel, but as it's supplemented by our private sector vets and AHTs, for example, the RMIS secondments, we have to cope. And I think we are doing well with relatively limited resources that we have. The increased operational cost, the war of Iran and the US is not assisting us like anyone else when it comes to just the cost of fuel. If you can't move your vets and your AHTs, you are stuck. And inevitably, price of transport directly affects this problem. Compliance with movement restrictions. As the disease seemed to be spreading to the western side of the Free State, that would be your Tokologo, Letsemeng areas, which is closer to Northern Cape. It seems to be clear to us that movement control and biosecurity measures is not in place in that areas, and that is something that we are putting a bit more focus on. Our emerging risks, I think we have spoken about that. Key challenges in our rural areas, the lack of fencing in rural communities, the interconnected grazing lands practiced in places like Kwakwa, impracticality of effective biosecurity as people move in the same areas where cattle are grazing, the challenge related to high density, high mobility and the geolocation of Thabo Mfutsenyane, but specifically Kwakwa, vaccine, human resources and transport. And then the way forward, essentially we continue to expand our surveillance, intensify vaccination, strengthen movement control, improve traceability, enhance stakeholder engagement, improve producer awareness, strengthening our collaboration with the National Department, increase monitoring of high-risk areas, and improve our emergency preparedness. Thank you very much.
Thank you so much for taking us through the presentation. My worry is that the Minister is going to leave at 11 o'clock. I'm going to just issues that you think they need the attention of the minister from the presentation. I'm going to allow honorable members just one matter, one issue that you believe they need the attention of the minister, because he's having another commitment. He's going to leave at 11 o'clock. Don't ask questions directly to the MEC, because we're going to take questions and clarity-seeking questions after 3 presentations from all the 3 MECs that are going to present. Minister, on my side, I have just one that I picked up from the presentation. I'm not sure what slide number is that, because when I looked at the presentation that we have, it is not updated. It doesn't have the information that I saw from that presentation. So Albertina is still sorting that out if you wanted to also raise that matter. The issue that the MEC has raised amongst the challenges that they are facing is the lack of consultation regarding court case settlement and the third-party reporting systems. I just want to get a sense, what is it that you are going to do to close that gap? Because they need to be informed of on the decisions that have been taken, and they need to understand their role as MECs in various provinces. I'm then going to note hence honorable members, so that a minister is going to respond on those, but only issues that needs his attention. I'm going to start with Honorable Mutaung. I'll follow with you, my sister, Honorable Mkotama, Buthelezi, Ndabezita, and Honorable Trollip is going to be the last person to raise a matter. In that sequence.
Thanks, Chair. Minister, no, it's only one. The issue of neighboring countries that haven't started to vaccinate, and because we have already started, is gonna damage what we have already started in our provinces. What is it that we are going to do urgently? Thank you.
Thank you, Chair. I'm just, when the MEC spoke about the BVI and that they might go back there, if not, I'm not worried about the finance now, but it came to mind that of all the doses administered, how many were primary vaccines and how many of that were the booster vaccines, more or less 6 months after the primary booster? I am going to ask it for all the provinces, so I don't know if we should wait till everybody's asked at the end. I don't know if the Minister or the MEC want to leave it till then.
No, thanks, Chair. I think that the department raised challenges on their side in Free State, and on the issue of why China. Then maybe the question is that why are outbreaks still rising despite vaccinations, and then why also the department. I think in the response from the department, it's very slow, and you don't quickly respond to the needs from the department. Thank you.
Thank you, Chair. Minister, just this matter of prices, can you clarify that the OBP versus the private sector, which provides this service at a better cost? And if the OBP is a little bit higher, then it's something that we need to intervene because OBP somehow is linked to the state. Thank you.
Greetings, Minister and the Deputy Minister and all officials and fellow members. My Minister's complex is the Sakelika case. It is setting a precedence that is taking a statutory mandate to be now shared with the private sector. What I need to know, the outcome of the judgment, does it also then say the mandate of the state is now amended to the point that the responsibility that will come as a result of this case, it means the state is no longer responsible for anything that will happen because the court have ruled in favor of the private sector. And attached to that, during the old order of the white regime, national meant whites only. In the democratic dispensation, it means now black mainly because of majority. But we are seeing a tendency where private sector is challenging statutory function through court and taking away a mandate that should be remaining in the state to take care of the 92% which happen to be black majority excluded in this industry. So please do reflect on this case and advise us what is the precedent set. Can the private sector take responsibility for the functions that used to be yours? Now we are sharing. Thank you.
Thank you, Chair. Mine as well refers to the old practice, Mr. Minister. In the olden practice, the department was involved in providing vets to each and every month visit the communal deep tanks, where they would make sure that they take samples of blood from animals and detect whatever disease that will come in before it is spread all over the country. Why has the department sort of withheld its practice on that one? That's the first thing. So secondly, the minister talks about that opportunity of access to vaccines by every livestock owner or farmer. If one looks at this, it's not an easy thing for communal livestock owners to have, I suspect, that access where they could buy those vaccines. And going as far as introducing those vaccines into their livestock, treating the livestock so that they could maybe make sure that it don't spread. Lastly, the issue of the border fencing. Some years back, there used to be a border fence on FMD, mostly affected areas like the further north of KZN, bordering Mozambique. And the fences have gone down. Animals are moving freely. They go as far as reaching the south of Pongolo River, or even Tumfolozi, as has been said that the breeding ground for FMDs actually is the northern KZN. What is the department doing about it? Thank you.
Trolip.
Thank you very much. Honourable Minister, thank you for your presentation about your change in strategy. I think it's long overdue. My question is related to you saying that all vaccines no longer have to go via OBP. We were told for the best part of this 7th administration that the reason that was done was that the vaccines had to be verified, that they were indeed so many and that they met compliance and according to PFMA regulations. What's happened to the compliance and verification and PFMA regulations that has allowed that to now happen? I'm very pleased that there's no longer demand exclusivity for import. And have you met with the ministerial task team that was established by your predecessor? Have you made any additions to that team? And then, Chair, my question is specifically around the role of stakeholder organizations. Milk producer organization, red meat producer, agri unions, and RIMS, RMIS. What is the role of RMIS? Who appointed them? Are they paid? Who pays them? And what precisely do they do in the facilitation process? I'll tell you why I ask that, Minister, because I'm getting feedback from the Eastern Cape that some people are starting to experience that through these various organizations, there's a system of vaccines for pals. Certain people get vaccines, stud breeders get vaccines, some stud breeders don't, they neighbor each other. Some farmers have got access through MPO, some get through RPO, but others don't get. It's a big concern, and I'd like to know what is being done about that. And then, Chair, I really want to commend the fact that farmers can apply to become authorised persons. I just hope that the system isn't too onerous or laborious to become registered. And then my last question is the ARC producing vaccines, and how many per month? Thank you.
I'm going to hand over to you, Minister. If you want your technical team to assist you in responding to some of the technical questions, you can as well delegate that to them.
Thank you very much, Chairperson. Yeah, it's a lot of questions. I'll take them from the beginning. Just want to make sure, is your surname Mutau? Mutau. Thank you very much. You asked about neighboring countries. I have met with the Minister of Agriculture in Namibia. I am tomorrow meeting with the Minister of Agriculture in Lesotho. And we have provided from government side 50,000 vaccines to Namibia, 50,000 to Lesotho, as well as 50,000 to Eswatini, so that they've got vaccines available should there be any outbreaks. We are also pushing for them to vaccinate in their countries. Remember, we can't go into their countries to vaccinate, but we would like them to vaccinate in the buffer area on their side of the borders. So those discussions are ongoing. It's very urgent. This disease does not see where a national border lies. Cattle, in many instances, coming to Nkosi Chibukulu's question, cattle roam freely over the borders. They don't care about that. All right. Mrs. van der Walt, on the primary booster and quantity, I don't have the full breakdown. Maybe the MEC can give that for the Free State. What I would like to say, however, is that of the 17 million vaccines that's been received, a huge amount of it has been applied. It is clear to me that in some way, maybe the feedback of vaccines that was applied did not come back. For me, it's important that vaccines should not be in fridges, it should be in cattle. And it should get there as soon as possible. We cannot sit with vaccines that's being held back because you want to maybe help a pal or a friend, as Honourable Trollop mentioned it there. It must go out there. The Milk Producers Organisation. In South Africa, we've got 1,385,000 dairy cows. They've already received 1.4 million vaccines. So every single dairy animal in the country has been vaccinated. We are now in a process of rolling out their booster vaccination as soon as possible. Various reasons for that. We all saw the devastating effect that the disease has got on dairy cattle. Secondly, a dairy cow has got a very long lifespan, where you milk and she gives you a calf and you carry on, and it's a long lifespan. If you compare that to slaughter cattle, cattle that's reared up to a certain weight and then it gets slaughtered. But very important is also that we must do field tests on animals that receive the booster shot. We must see how they react. Is it efficient? And that is why we are trying to do that with the dairy cows. And we've got to also, and Chairperson, let me, as a side, bring this in because this has not been asked in a question, but we need to, from government side, up our capacity to do laboratory tests afterwards to make sure that we are in front of the strain, to make sure that what we are applying on vaccines are still required for the strains that we've got. It's also very important that we see what the effect of that is. So testing that, we are busy with the Ministerial Task Team as well as the Industry Coordinating Council to see what we can do. I've had discussions with Dr. Dani Oudendal, who is also providing assistance with that to see how can we get laboratory testing done more frequently and quicker as well. Honourable Ndalani, you ask why the virus are still spreading. This is the biggest outbreak ever of foot and mouth disease in our country. And I think one of the main reasons are that, apart from the fact that it's already spread all over, we need to increase our biosecurity. Anyone here, ask yourself if you, in the last year and a half of this disease, ever once saw a roadblock for foot and mouth disease. I have not seen one. Not by national police, not by any provincial traffic department or any local government policing department or traffic department. I've not seen one. But that is from a government side. I've said it earlier on, the whole issue of biosecurity start on the farm. It's your responsibility as the farmers, and our farmers know that. So I would urge any farmer out there who does not have biosecurity measures on your farm, protect yourself, please. Protect your neighbor. So that we start with biosecurity on our farms. I've already had a discussion with all MECs. I've called a MEC where we discussed foot and mouth disease and what's going on there. And in that meeting, I've urged all the MECs to go and speak to their counterparts that's responsible for policing or for safety in their provinces, so that we can have communication between our MECs and them, so that when there's outbreaks, they can help us to block off and cordon off areas. If we can contain the virus, we've got the vaccines, it will be there, but we've got to adhere to biosecurity. So I think, Honourable Ndalani, the biggest reason is we don't adhere to our biosecurity measures. And that is what is assisting it to spread. We've got to get vaccines out there, and we've got to proactively vaccinate. That will also help a lot. I hope that answered your question. Honourable Nkitama, your question regarding OBP and cost. The cost from Dolvex, Dunevax, the Dolvex vaccine coming from Turkey, can be distributed anywhere in the country by Dunevax at 45 Rand a vaccine. So any veterinarian office or practice in the country can get the Dunevax at 45 Rand a vaccine. The Biogenesis Bargo is at approximately 44 Rand. So it's 44, 45 Rand that they can provide it with. The problem that we had is Dunevax will distribute it to a certain point. Now that point was OBP. So OBP got it. Dunevax said we'll distribute it there. OBP insisted that it must go there. So it landed there at 45 Rand. And then OBP did the distribution. And they incurred cost. Surely they incurred cost. They appointed people to do that for them. What we have now done is to cancel out the movement from the airport to OBP. There's no need for OBP to do delivery costs because they're not doing the delivery anymore. The importer himself is doing the delivery. So it's airport straight, not airport OBP and the veterinary practice. So I think it's from a cost point saved us quite a lot of money. When OBP buy directly from whoever the importer is, and they get it to their place and they then distribute it, surely they must add the cost. But I would urge OBP not to let it go to OBP. If OBP knows that they've got people that want it, tell the supplier that please deliver my vaccines to X, Y, and Z places all over the country so that OBP does not have to incur that additional cost. So I hope that answers your question on that. We need to cut out middlemen. That's not necessary in this whole thing. Honourable Mtetwa, very interesting question. One don't have the luxury when it comes to who litigates against you, who you must oppose or not. If you've been litigated against, you've been litigated against. In this instance, it was SAI, Sake Liga, as well as Free State Agriculture. And their main source of contention was, why can't farmers vaccinate themselves? We did not agree on everything. They thought that it can be a matter of vaccines can just be applied by farmers, and we had to sit down, and that is the importance of speaking with each other. Because when we sat down and we showed them the law, they said to us, okay, we understand that, and we got to a settlement where we firstly said to each other that everything that we agree upon will be in terms of law. We can't make a settlement or reach a settlement agreement that's not in terms of the law, and everybody agreed on that. The second thing that we said is everything that we agree that will become an order of court must still allow us to get to a point where we can approach WOA, the World Organization for Animal Health, to get FMD-free status. And everybody agreed on that. So when those 2 points were agreed, we could sit down and say to each other, it's not a matter of every farmer can just vaccinate. The law says he must apply to become an authorized person. And we worded the settlement agreement so that we adhere to the law. Now, it's very important to answer your question, because your question came with a bit of an accusation that government is now relinquishing its duties to the private sector. It's not. We are using the law to get the full cooperation of the private sector. Government is not relinquishing our duties. Government will still, where there's outbreaks, go in those areas and vaccinate not only the area that's got an outbreak, but also the buffer areas around it. Government will still go and help any farmer, irrespective of color, that cannot afford this vaccine or that does not have the facilities to administer this vaccine easily. Government will still do that. But it's very important that we must realize, for us to win this fight, we should not beat around the bush when it comes to the truth. We've got 15.2 million cattle in this country. If you go and count the amount of veterinarians in this country, there's absolutely no way whatsoever that we would have been able, with our veterinarians, both private and state veterinarians, to beat this disease if they had to be the only ones that can apply that. Even if you put veterinary technicians in, we would not have been able to do this. And we would have been chasing and chasing and chasing this. So I'm so glad for the involvement of the private sector, because that will now lighten the burden of the state veterinarians, so that they, and the private veterinarians, but especially state veterinarians, so that they can go into those rural areas where there's such a high need for this. We cannot only protect our commercial farmers, we must protect everybody. We must protect our communal farmers, we must protect our upcoming farmers. And if we're going to think that we're going to protect our herd by only protecting a certain amount of people, we're making a big mistake. All the commercial farmers in the country can buy vaccines if they want to. Any farmer can. But they are going to fool themselves if they think that they should not help people that cannot afford that and that cannot apply that. Because if they don't do that, in a couple of months' time from now, you will think you're safe and your neighbor is safe. But then there's one communal cow that walks around there that hasn't been vaccinated because that person hasn't been helped. And that cow can again distribute the disease to a lot of people. So we need to stand together. And that's the point that I want to make. And when I say commercial, I'm not talking about white farmers. There's a lot of black commercial farmers that I've met in the last month alone. Met a lot of them before. That commercially farm. I attended an auction, a Boran auction on Saturday in Ermelo. And it was so good for me to see the diversity of commercial farmers there. And each and every farmer there, commercial farmers, they've got money. Black or white, doesn't matter. Said, thank you, we will buy the vaccine, we will carry on, and we will help the people in our community that cannot afford that. So just on your question, it's not a matter of government negating on its duties. It's a matter of government within the law, taking hands with the private sector, which is definitely helping us to put our efforts and requirements where we need it very, very dearly. Let me just firstly answer all the other questions. Nkosi Chibukulu, you spoke about the dip tanks and why has that been stopped. I don't have the answer for you, Nkosi. I assume that it might have been over time, over many years, due to financial constraints or mismanagement. I don't know. That's what I assume. But I will see what we can do in that regard to get you a proper written answer on this, if you don't mind. I won't sit here and spin a story that I don't have the information on. Then, with regards to what we've rolled out, Nkosi Chibukulu, you've also asked that. I've met with AFASA, the African Farmers Association, I've met with Agri-SA, all the agricultural organizations. My meeting with AFASA was a very interesting meeting. Firstly, I can't speak on their behalf, but you can go and read their press statements regarding that. They welcome this settlement agreement, and they welcome each of the plans, the online system, etc., that we from government side has put in place. They welcome that. But we've also looked reality in the eye to say, I realize, I know that there might be a rural farmer that's in an area where there's no internet access. How's that farmer going to apply online? We know that. There we must still assist, and we will do that. Where there's a person that does not know how to work with the system, we will still assist. And we will get the help from AFASA, and we will help them as well to take hands so that we can go into those areas. Again, the mere fact that the private sector will now be able to take a bigger responsibility will assist us to have more hands on deck to also go in those areas and do that. But not one single agricultural organization is opposed to. In actual fact, everybody welcomes what we are doing. You also raised the issue of border fencing. I fully agree. I've already answered it with regards to the meetings that I had with my counterpart in Namibia and the one that I'll have tomorrow with Lesotho. But I agree, we need to look at fencing. But in a lot of instances, that fence also belongs to the farmer. It's the farmer's fence, it's the border fence. We must share the responsibility. And where there are fences that are down, report it so that we can see how we can help to fix it. But let's look reality in the eye, Mr. Chebekulu. The fact is, over many years, it's been neglected. How does a cow doesn't have a ring around his neck that shock him the moment that he steps into another country? They just graze, and we know how that looks. There's places where there's no fencing at all. It needs to be looked at. But for us to think that we will win this disease if we are not going to assist our neighboring countries would be foolish. We'll need to assist them as well. And I'm looking forward to my discussion, especially with the Minister of Lesotho tomorrow in that regard. Honourable Trollip, you've asked for the whole issue about OBP and the PFMA regulations. It's not a matter of PFMA not being applied now. When the private sector import, there's no PFMA involved. It's a private transaction. So it's not that they do it. When OBP imports or when government places an order, those regulations still apply. There might be a difference in pricing, but we, as I said, are trying to see how we can get the importer to distribute it and deliver it to a place that we predeterminedly tell him to, because that will cut out a huge amount of time, firstly, and cost on the vaccine itself. The issue of demand exclusivity, I fully agree with you. There should not be, and we will not insist in future to have that. There's no need for that. You've asked how often, or have I met with the task team as well as the Industry Coordinating Council? Yes, I have. I think it's very important to meet with them. I can't give technical advice to the task team, but it's very important for me to sit there and listen to what they say, because I, as Minister, have got to get a better understanding. I'm not a veterinarian, but I need to guide them. And they need to advise me, so it's very important that I am attending the ministerial task team. I'm not going to attend every single one of them. There's a lot of technical stuff that they sometimes do, but I do appreciate it if I attend it. I've also attended several industry coordinating councils, and as you rightly asked, I have expanded the council. I've included Dr. Dani Oudendal as well as Dr. Theo de Jager from SAI. The reason for that is we've got all the other agricultural organizations there. TLU, AFASA, Agri-SA, the Red Meat Producers Organization, the Milk Producers Organizations. SAI has got a lot of members and they've got a lot of influence. We need to create a positivity of what it is that we do. There are still people that think that vaccination should not take place. They can help us to communicate the necessity of this. They also got their own networking structures that they can help us with. Sorry, Madam Chair. Dr. Dani Oudendal has got a veterinary network of 200 veterinarians. That is of utmost importance to utilize when we are talking about the rollout of this vaccination plan. We've got this network that is putting at our availability. It would not be good if we are not going to make use of that. So I believe that both Dr. Oorendal and Dr. De Jager's presence on the Industry Coordinating Council will definitely assist. And then I've also expanded the terms of reference of the ICC. The ICC has always had as a term of reference the rollout of the vaccines. But I'm making it specifically because of the fact that the playing field has changed. There must be a bigger concentration on the effective rollout of the vaccines, especially in light of the settlement agreement that was reached. The fact that private sector can now bring it in distributed without having to go through OBP, and the fact that farmers can vaccinate the animals themselves. So that whole terms of reference changes, and I'm looking forward to my next meeting with them to see what's going on and how they are communicating them. Then, Honourable Trollip, you asked the whole thing about stakeholder entities that's out there. I have just now said RPO, RMIS, the Milk Producers Organisation, all of them form part of the Industry Coordinating Council. In actual fact, there is now, after the incorporation of Dr. Oorendal and Dr. De Jager, there is no cattle organization or organization that's involved with cattle breeding that is not on that team. Everybody is included. If there is anybody that I might have left out, I would like to be notified of that because I would like to involve them. But as far as I know, that every single industry player is there. Now I can promise you, and that is why everybody should be there, I can promise you that Mr. Fani Ferreira from the Milk Producers Organisation will push hard for his constituency. He will, and that's his job. He's got to do that. Same with Dr. Frikkie from the Red Meat Producers Organisation, Frikkie Maria. So everybody will push for his constituency, but nobody has got the right to unilaterally say you can get and that's it. It cannot happen. RMIS is also now importing vaccines via the importers. They're paying for it themselves. We must remember that now that the private sector is allowed to order and to pay with their own money, they can give it to whoever they want. If a feedlot owner wants to order 2 million vaccines and he can get it here through an authorized Section 21 SAPRA approved importer, it's a free market system, then they can do with it what they want. What we must not allow is that vaccines that's in government's hands or in OBP's hands get distributed to friends and family. It does not work like that. We've got to work the strategy, and that is what the MTT, the Ministerial Task Team, together with the Industry Coordinating Council in their joint committee meetings do. And I've called it the bomb squad. With the expansion of the ICC, working together with the MTT, having a sole focus on getting more vaccines in, getting it distributed fast, and get it vaccinated quicker. That is now our bomb squad. We must rely on those knowledgeable people to be the bomb squad that will now help us to fight and win this match that we've got against FMD. So, there was a last question that you've asked. You've asked a question about ARC. They are producing vaccines. They are producing roughly 20,000 a month. Initially, they did a monovalent vaccine that did not take that long to manufacture. They've moved over and are now producing a trivalent vaccine, a very good vaccine. But the process is longer. They are currently manufacturing 20,000 a month. When they increase their capacity to a 1,000-litre system in more or less March next year, that would be completed. Their production will go up to between 250 to 300,000 vaccines per month. And hopefully by then we would have stopped a big part of this in our tracks, and I think that that would then play a huge contribution towards us fighting this. Honourable Trollip, I think I've covered most of them. Chairperson, that is basically it from my side. Thank you on the questions that were posed. Don't know if the DG or anybody wants to come in on a technical side. DG, you're more than welcome.
Okay, thank you, Minister, for responding to those questions. We know we're in a digital world now. Young people are sending me a question here to say, Chairperson, could you ask this question on my behalf? It says, the National Department previously reported to the committee that the red meat industry services allocated 20 AHTs to provinces and 8 of those to the Free State province. However, the MEC from Free State reports that the province has not received any additional AHTs. They want the National Department then to provide the response in that regard.
Ma'am, sorry, they did not read
Animal health.
AHT,
yes.
Animal Health Technicians. I thought
Yes.
AHTs.
AHTs.
Yeah. Madam Chairperson, I don't know at this stage how many animal health technicians have been deployed to the various provinces. I will find out. I don't know what the situation is there. I can ask the DG to assist us in that, maybe. Dr. Mokhajani can assist us here.
Thank you, Minister, honorable members. The RMIS donated 12 animal health technicians, and then 8 of them went to the Northwest. And the reason being that there were 4 other, they donated first 12, and 4 went to Northwest, 4 went to Free State, and then Free State could not accept the 4 due to the fact that RMIS donated them with some conditions, saying that they have to report to their system, and there was other conditions which were created, and I think Free State could not accept them at the time. So the other 4 were supposed to be going also to Gauteng. And also I think Dr. Rabolao is here, maybe can explain that, honorable members, in Gauteng, what happened.
No, we're just focusing. Is having something that she wants to raise as well. Tiam?
Thank you very much, Chair. It's just not technical, Minister. It's in addition to the what you have made as your input with regards to FMD. Mine would then be what we pick up when we go to the dipping tanks. That infrastructure is a bit dilapidated, and it becomes impossible for the injections to take place because animals are not properly confined. But also we can't rely on medication, vaccines, and so on. We must also be able to take those clinics, like any other clinic, health clinic or what. The environment around the dipping tank is very much showing that it can contribute to even animals that were not affected when they go there. There is actually, the infrastructure is very poor. You don't even a shelter when you want to sit down and talk to people there. The roads are extremely bad to most of the dipping tanks. It's even dangerous to animals getting there. I am raising this because we do have the allocation of a CASP, but I think CASP now is becoming a fund that looks like a particular grant that every emergency can pull from there to help farmers. I think it should be strictly attending to that infrastructure and also the cleaning terms. It's really bad when you go to the dipping tank minister and the members of the portfolio committee. I was raising that so that we can also see it as a challenge and as a contributory factor to infections that might be happening there. Thank you very much.
Any parting shot?
I fully agree with that, Chairperson. The Deputy Minister hits the nail on the head, and that is also coming back to the question of Nkosi Chebekulu, as well as Mr. Mtetwa, Honourable Mtetwa. We know the shortcomings that we are experiencing in our rural areas, and we would have neglected those people. We would have negated what our duty was in those areas if we did not go into this agreement. The new way of handling this clearly lessened the burden of state. It now gives us the opportunity to go into those areas that the Deputy Minister have now explained to us and really make sure that we help those people. It would be foolish if we thought that they must get on their own. And they don't have a kraal, so we must help them. If we've got to put in mobile facilities to do that, we must do that. But now we've got more time on our hands and more hands on deck to also do that. So I fully agree. I cannot take responsibility, though. It's been a neglect over decades of infrastructure and no maintenance on that by various departments. Thank you, Chair.
Thank you so much for those responses. Maybe when you go back, Minister, you must also provide us with the written response on the question that I've raised, because the presentation that we received as the Portfolio Committee on the 26th of May 2026 indicates that RMIS appointed 20 technicians and allocated 8 to the Northwest Province and 8 to the Free State Province. It doesn't even talk about some of the constraints that they faced in terms of their allocation, that there was conditions that maybe the provinces did not adhere to, so it was withdrawn. So that's the state of affairs in terms of the presentation that was tabled before the Portfolio Committee. Because I don't want back and forth, province also responding to say this and that. Just provide us with a written response in this regard. Secondly, Minister, because we are about to leave, we understand as the Portfolio Committee that FMD has been classified as a disaster, and where they visited the province, I think last year, if I'm not mistaken, and the Portfolio Committee after that had an engagement with the Cocta Ministry and the National Disaster Management Center to advocate for the declaration of a state of disaster. The committee, that's what it wants, so that it will enable the release of emergency funding and the deployment of resources to address FMD. So we just also want to get an update on how far are you in terms of implementing this, what we are advocating for as the Portfolio Committee. You can provide that in writing, we don't mind. Oh, you want to respond now, I can see. When you're responding, then you wrap up, you can then leave if you feel like you need to leave because you requested to leave. Oh, Sondo, you can just quick, yes.
Thanks, Chair. Just 1 second. Minister, I just want to get a clarity on one, in your ministerial tax team, how is the composition of it? How many are from private sector? How many are from public? Lastly, how are the common ages or house of traditional leaders represented? Are they there or? Okay, thank you, Chair. Quick one.
Chairperson, I think Tetwa also indicated earlier on that he's got a follow-up question. If you want to allow him, then I can try to wrap up everything at once.
Thanks, Minister.
Just be brief, Honorable Mtetwa.
Kulungile, ma.
Please, just be brief.
This is it. Constitutionally speaking, there is no oversight function on our part to oversee private sector, as this judgment has now issued a dual function in terms of rendering the service. Now, what are then recourses in law that we have to oversee whatever that will be done by private sector? Because as we would attempt to, they will then say you have no reach over us in terms of constitutional and legislative overreach. Thank you.
Yeah, it's good that our minister is a legal guru as well.
I won't call it the guru, but I did study law. Chairperson, firstly, on the question that Honourable Mtong asked, the MTT consists of 50% of government knowledgeable people, mostly veterinarians, and 50% of the private sector. So, and various areas and academic specific areas in the private sector. So it's a good combination. I tell you, I sit in that meeting and I realize that we definitely have got the best technical, knowledgeable people in the country when it comes to diseases and a disease like this around that table. Then I also, and that is maybe my way of approaching to this, but I don't hesitate to contact somebody should I need help. Even if it might be somebody that's not on that. Or if somebody phone me and says, listen, I've got this or that I want to advise you. I'm listening to them and I will always discuss it with the people advising me on that. But I firmly believe that between the Industry Coordinating Council, as we've got it there now, and the MTT, as it's there now, that joint committee really is what we need to roll this out from a practical point of view. We've got every agricultural organization, a huge veterinary organization. We've got on an ad hoc basis, and I forgot to say this earlier on. So it's not only the expansion of the Industry Coordinating Council. On an ad hoc basis, the vaccine suppliers will also serve on the Industry Coordinating Committee, because I think it's very important to have the people that's bringing in your vaccines to be able to communicate with you. They cannot be there permanently because sometimes there are issues that's discussed that might be market sensitive, but they are there on an ad hoc basis that will really help. You asked about traditional leaders being represented. We are working with people in the industry. So every single organization that's there is directly involved in cattle. Let's talk straight. Most of the traditional leaders, if not all of them are black. And they are represented primarily by AFASA. Most black farmers are of AFASA. And I don't like the fact that most black farmers are AFASA and most white farmers might be in some other organizations. I would like to see an integration of that. But what I can tell you is that it's everybody's right to decide to which organization he belongs. But what is very good for me is to see the cooperation between these various agricultural organizations. How AFASA and Agri-SA and TLU and SAI are working closely with each other, and they are cross-helping each other. So no, the traditional leaders per se is not directly involved, but if they want to become involved via the members and AFASA, they are more than welcome. And I will always listen to them if they've got advice that they've got to give, or if they've got problems that they want to discuss. My door will be open for them, definitely. Thank you. Chairperson, then back to the last question then of Honourable Mtetwa. Honourable Mtetwa, there's a huge difference between constitutional oversight and what the law gives you power of. Not everything is written down in the Constitution. The Constitution does not say, I'm not allowed to make loud noise at night. But there's a law that says that. So the Constitution also does not say what we must do specifically when it's come to a foot and mouth disease outbreak. But there are laws that guide us in that. And what we've done here is we've followed the letter of the law. So government gives the right to private sector owners to vaccinate themselves. But that's on a condition, and I said it in my introductory statement. You will only have that authority as long as you give feedback on the information that we, in terms of law, need to provide to the World Organization for Animal Health. If you are not, as a farmer, providing that feedback to us, your delegation to be an authorized person will be withdrawn. You will not get a delegation again to do that, so you're shooting yourself in the foot. So it's not a matter of oversight, it's a matter of within the law cooperating with each other. And I would urge again every farmer out there to please apply. It will help you, it will help your neighbors, it will help government, it will help everybody. And then after you've applied your vaccination, please give us the report back. It's easy to do. It's, you can go onto the website and go and test it. We've not overburdened people with a lot of questions that's irrelevant for this. We need to have a proper tracking and tracing system in the country. And I've been approached over the last month by various companies that wants to say, but ours is the best, ours is the best. And I just said to them, I don't have the luxury of going through a whole procurement process at this moment. If RMIS wants to use their system, or if Dunevax wants to use the Buffalo Analytics system, I really don't care. But we've set down the minimum requirements that we want. And all those systems, I don't care what system the private sector uses, all those systems must at least provide that minimum requirement of information that we need. And it must be integrated with us. Then we'll take it from there. Do we need a proper system in the country? And let's help there. Absolutely we do. But I'm not going to get caught up in this day and age and time, in this virus that we are battling, to now decide on one. Everybody can come to the party and assist in that regard. I hope that answered the question. Thank you, Madam Chairperson.
Thank you so much, Minister, for those responses. You may leave. We're moving now to the next presentation. Pleasure. We're moving to the next presentation. Mpumalanga is going to present. Because Free State is done, they can move to the seat where Mpumalanga is sitting, then they move the site. We are going to have discussions after the presentation of Limpopo. MECs are going to get an opportunity to respond or to speak or to make some comments.
It was just a clarity.
Oh, okay.
Thank you, Chair. I wanted to make the clarity before the Minister left, but Deputy Minister is here. We should not be confusing the AHTs that was going to be appointed by the Department of Agriculture and those appointed by RMIS. On 7 May in Minmec, the report was that the AHTs by Department of Agriculture was going to be appointed. They were going to appoint as interns on a 24-month contract. RMIS AHTs were appointed on a 1-year contract. It's two different categories that we should not be mixing. And even on 3 June, the report was
Which ones did you receive from
RMIS. Yeah, we have not dealt with the interns from DOA, the AHTs, yeah, thanks.
So the department, when they are responding in writing, they must explain both what is happening with regards to this one and the other one. ARM, what is it? Yeah, but there are 2 categories, whatever it is. But yes, they must just explain to us what is the state of affairs. Mpumalanga, are you ready to present? Yeah, over to you, MEC.
Should you move that side, Chair?
Lipopo, are you ready? Is your system compatible to what we have here? so that we can move to you whilst they are busy sorting themselves out. You can come, my dear, if you are ready, if yours doesn't have any problem. Are you sorted? Pumalang, okay, okay. MEC Kekana, you can come and present. All of you have problems. I'll move to my honorable. I think we're fine. Oh, you're okay. Okay, all right. Let me see. Okay. No, thank you very much, Chair. Greetings once more to yourself and to the Deputy Minister and all honorable members and the officials. Chair, if you allow me to just go straight to the presentation. As I have indicated, I'm MEC Keti Womoketi from Mpumalanga. Yes, Chair. As in Mpumalanga, the initial outbreak that we experienced was on a farm in Volkrust, Dr. Pixley Isaka Gasem in Kharsibande. It was in April 2025 through the cattle that were sourced in an auction in KZN in February 2025. Chair, these animals were reportedly isolated for 3 weeks by the farmer on his farm before mixing them with the herd of 42 other cattle. Then there were 5 more heads on the farm, making it a total of 289 cattle affected, including 2 dairy cattle and including the 22 that was purchased. Chair, there was also 1,580 sheep that were in a different camp. The sheep were tested, inspected, and never found to be infected. And Chair, Khaksibande, particularly in Palisengi and Dr. Pixley Sakaseme was identified as a hotspot where we piloted or done our first vaccination, followed by Nkangala, in particular in Victor Khanye, then it was Ehlanzeni. This is the summary of outbreaks and suspect cases as in the 1st of April 2025 to the 31st of July 2026. Ehlanzeni, the number of outbreaks, 31, number outbreaks open, 31, and the suspect reported it was 3. Khaksibande, outbreaks 150, closed, 37, and open 113. The suspects were 93, and in Kangala, 78, closed were 48, open 30, and suspect were 31, which takes us to a total of the entire province, the outbreaks 259, closed 85, opened 174, and the suspects 127. Chair, this is a graph that is showing that in Kharsibande, we have that high percentage of 58%. In Kangala, 30, and followed by Ehlanzeni. On slide 6, Chair, this is the vaccination campaign from the March 31st, from March until 31st July 2026. Chair, the vaccine that were received or were allocated to Mpumalanga ARS, we received about 2,000. And we have administered 1,805, which takes us to that percentage. The losses were 195 in hand is 0. Then biogenesis. In Feb and April and June, we have received that number. And then the administered in Feb is 97,554. In April, it's 94,000, and in June, it was 158. This is the percentage that indicates how much we have used as the province. Then there are losses in hand. In Feb, we had 878, biogenesis, April, 93, and in June, 7301.
Dolvet, on the 12th of March 2026, we were allocated 95,000. In May, it was 144,000, and the 19th of May, 144,000. Recently, we were allocated 150,000. This is how much we have administered, and these are the percentages. So for the entire province, the allocation in total that we have received is 897,000. 745, 282 is what we have administered, meaning that it takes us to the percentage of 83.1%. Then the losses accounted to 5,026. In hand, we have 146,692. This includes the current that we received in July. Chair, we have planned that we will start a booster vaccination in September 2026, 6 months period post-vaccination. And there were some booster vaccinations implemented in controlling some outbreaks to cap the spread around the Hlanzeni and in Buhlabele Bushbuckridge. On the next slide, vaccine and doses and vaccination by the 1st March to July 2026. I think it indicates the percentage that is present on the previous slide. But here, Chair, we are indicating on column 1, 2, 3, 4, 5, 6, column 6, that the cattle estimated from MTT research is 491,736, and then MVS is 233,274. Then the vaccination coverage from MTT, it indicates that 37.8%, then MVC is 79.5%. That is at Hlanzeni. In Gaksibande, Chair, I will just focus on this column of cattle's estimation. From MTT, it's 884,559. Then the MVS is 877,287. Vaccine coverage, MTT is 38.2%. The MVS is 38.0%. Then in Nkangala, the cattle estimates from MTT, it's 492,625. MVS 369,680. Then the vaccination coverage, MTT 4.51%, and MVC is 6.1%. This is the total, Chair, for the entire province. Then the causes of the vaccine losses, it's because of the breakage, sometimes the frozen, spillage, leftover, as sucked in the automatic. And the left vaccine that could not be used the following day as per the manufacturer's indication. Preventative measures to minimize losses. Chair, what we are experiencing from the private vet is that they do not share information after they have received the vaccine, meaning that we have decided as a department that we do not distribute until we receive or they account on what they have received. Estimate the number of animals to be vaccinated before opening vials. Use appropriate vial sizes. FMD vaccines to be used on the same day or within the time specified by the manufacturer once opened. Handle vials carefully during transport and use. Maintain accurate inventory. Notify farmers well in advance so that turnout can improve. Procure quality equipment to avoid leakage, regular maintenance. Procurement of better quality syringe underway. Also improve logistics, meaning that maintain cold chains and also deliver vaccine shortly before vaccinating. Next slide. Chair, the LITS system. Training and piloting of LITS was done by the Department of Agriculture. Obviously, the funding was not from the Mpumalanga. The system was never rolled out to the rest of the province, Chair. I think that is what we are raising, that we, as a department of the province, we could not continue with the LIT system because of inadequate or insufficient resources. So we're depending on the national department as per their commitment that they would be supporting us as the provinces. We are continuing with the SAFICE system, which we are implementing currently in the protected zones. And the SAFICE data will be imported into the lead system once fully rolled out. So the system does not, however, cover the previous zones. Chair, on handling of a vaccine and also the infrastructure, the province endeavors to collect vaccine from the distributors. That is not about the carrying capacity of the vaccine. The vaccine is distributed to the district where we have a storage. They are further distributed to the state vets where they are kept in fridges. The vaccine will be collected by the animal health technician or state vets on the day of vaccination. The department has also established the PPPs with a private organization with expertise, industry and private vets for further assist in administering of the vaccine. Chair, the next slides indicate the livestock commodities affected by the outbreaks and vaccinated as in for the 1st of March and until the 31st of April 2026. It is per districts and the different livestock commodities. The sheep in Ehlanzeni is that number of 214, goats 120, and the dairy 175, the state 140, feedlot 0. Chair, if you allow me perhaps to just indicate to honorable members that we have categorized as per the district, and this is the total. For the province, the sheep 1,391, goats 493, the pigs 2,915, dairy 25,249, state 21,085, and feedlots 12,838. The commercial and communal cattle vaccinated. The table above, I think, indicates as per the districts. Underneath, Chair, we are indicating the total of animal vaccinated, 746, 317, the entire province. Then takes us to that percentage for commercial and communal. Then the heads vaccinated, 25,642, and the commercial is that percentage 54, and commercial 54, and communal 46. And from the vets sector, we have that 9.27%. And this is the special categories of animal vaccinated. I think we have indicated in the previous slide. Chair, slide 15, foot and mouth disease control strategy. In Mpumalanga, FMD control strategy is in line with Section 9 of Animal Disease Act, which inter alia includes the quarantine of infected or affected premises or farms, movement permit, animal movement control, interprovincial movements, application by province of origin and approval by province of destination, vaccination data risk-based as advised by the MTT, weekly, bi-weekly and monthly inspection of livestock, surveillance, biosecurity measure, of which farmers are educated and employed to implement strictly the awareness on the disease and to report any suspicious to vets authorities. The capacity to address the FMD outbreaks, as the province recently, we have appointed 10 state vets who were bursary holders. We are still in need of the animal health technicians, Chair, of which we believe that as the Department of Agriculture, National Department, they have committed, they will still give us the 20 animal health technician. Also, the vehicle shortage is still a challenge, dilapidated deep tanks infrastructure. As the province, we have started to refurbish some of them, but we are limited by the financials or the resources that we currently have. we have set aside or allocated a budget of 10.6 million on FMD-related support. To quarantine facilities, we need to refurbishment at Nkomazi nase Bushbuck Ridge. Chair, the next 3 slides indicating the skills required as per our organogram as at the 30th of June 2026 under animal health, vets clinical services, vets public health. So the columns are showing the total posts that we currently have in our organogram, the field posts, the vacancy. Yes, the 3 slides, Chair. I do not want to go one by one on each post. Then on slide 20, the livestock estimates in Bushbuck Ridge, Chair, meaning this is Ehlanzeni. The total of Ehlanzeni, the estimate cattle from the MTT, it's 491,736. The estimates from MVC is 274,000. The estimated sheep is 9,017. The goats 37,506, and the pigs 19,988. And in Garsebande, the livestock estimates cattle 88459. That is from the MTT, then it's 877 to 87 from the MVS. The sheep's it's 504472, and the goats 255370, the pigs 171,139. In Nkangala, that is the total of 492,625 on cattle, and on MVC 369,680, then on sheep 34,400, goats 20,220, and pigs 269,810. So for the entire province, the estimate is 1.8 million from MTT, and from MVC it's 1.4 million. Estimates for sheep 547,889, estimated goats 313,196, and estimated pigs 460,937. Chair, the cattle that were slaughtered, we are only counting those that are from Mpumalanga, sourced from Mpumalanga. Garsebande, it's 21,616, in Kangala 14,079, and in Hlanzeni 1,627. Takes us to a total of 37,222. In conclusion, Chair, before the start of the mass vaccination campaign in March 2026, outbreaks were uncontrolled, sporadic. The province has reached a vaccine coverage of approximately, I think we're about 50%. The outbreaks are stabilizing. It is becoming rarer to get new outbreaks, Chair. The province endeavors to have more animals vaccinated. Challenges highlighted need to be addressed for the 80% target to be realized by end of August. Thank you very much, Chair.
Thank you so much, MEC, for taking us through the presentation. However, we're also observing that we don't have an updated presentation. I'm going to request all provinces to share with the technical team an updated presentation. For instance, the one that I have doesn't have any conclusion. It doesn't have the slide that speaks about LIT system. So please make sure that you share updated presentations with honorable members. Otherwise, they are going to start fighting me, and I won't be in a position to defend you, honestly. Please, those who haven't tabled their presentations, I'm going to advise them to share with the technical team so that Albertina is going to share with honorable members. Please, good people, are trying to be sweet with you, but you are not assisting the process. I'm going to move then to MEC Kekana to take us through the presentation. Speak to your technical teams to share presentations, updated ones, please. Because we're trying to follow, but we don't see what you guys are speaking about.
Thank you, Chair. Siyaxolisa. Humble apologies, siyaxolisa.
Thank you very much. Thank you very much to the Honorable Chairperson, also the Chief Whip, and Honorable Mutaung, and all members of the Portfolio Committee present here, all the Minister for Department of Agriculture and Rural Development, Honorable Okamp, Deputy Minister, Honorable Kapa, all the MECs present here, our DG and the DDGs, and all the technocrats present here. From the Department of Agriculture and Rural Development, Limpopo, I'm accompanied by Dr. Mabunda, responsible for veterinary services, and also the director responsible for that program, also Mr. Mujapelo. Chairperson, I want to indicate on the background purposes where we are highlighting the foot and mouth disease as a highly contagious vesicular disease, of course, which affects the cloven-hoofed animals as reflected here. And again, we are also reporting about the African buffaloes, which are natural reservoirs of the foot and mouth viruses. And as the Department of Agriculture and Rural Development in Limpopo, this is where we are experiencing serious challenges due to the reservoirs of African buffaloes, due to the fact that we are neighboring the border gates of Mozambique, Zimbabwe, and other provinces. So we also, on the background, give the indication of the symptoms, of course, that is reflected on the screen, and the type of serotypes, which is SAT1, 2, and 3. And in the main, our province is affected by the SAT2, which affect mostly our cattle. And the impact that comes as a result of the foot and mouth disease is also reflected on our introduction due to the livestock productivity, because the animals that are experiencing the foot and mouth disease will thus lose weight and appetite, hence affecting their productivity. The issue of trade and market access also have a huge impact on our farmers due to the disease, and also it impacts negatively on our rural livelihoods and food security, defeating the mandate of the department, of course, to make sure that we provide food security and also make sure that we increase our economy for sustainable livelihoods of our communities. So South Africa, Honorable Chair, has an established foot and mouth control framework that we are all following, including our province. And also we are indicating that out of the strides that we have gained since the foot and mouth disease that occurred late in 2020, due to the stringent surveillance as the province, that was during the time of Women Ndalani, Honorable Ndalani, when she was still the MEC there, we were able to beat the target. Within a period of a year, we were then declared a foot and mouth disease by World Organization Animal Health. So with the inception of the new foot and mouth disease that has since been classified by the president of this country, We then experienced the first case in December 2025 at Kuvi, which is Thulamela local municipality in the Vembe district, Vivo auction in the Blowback under Capricorn district, and Loipot farm under Mudimule Mokopong in Waterberg district. And this area is also our agroecological zone of the red meat Mudimule Mokopong. So we have 155,734 cattle which were susceptible in those 3 municipalities. So the outbreak affected both the communal and commercial cattle, with dairies suffering the most because of the effect on drop in milk production, and calves with FMD actually succumb to the disease. The next slide is on the total number of livestock in the province, where we are reporting about 1.18 million of the total number of our livestock, and it is desegregated in terms of the districts as alluded in the graph. So the next page will be on the latest FNB outbreak cases in Limpopo as at the 24th of July 2026, where we are reporting 540 investigations that are conducted, with the positive ones being 108, the suspects 86, and those tested negative were 156, with 9 closed cases where we were exempted or were to quarantine our animals in line with Section 23, Act number 35 of 1984. And we had the pending ones for the one that we are still awaiting for laboratory results, which I think it takes a bit longer, but we are continuing to make sure that as and when we want the result or we request the result from them, we're able to obtain them, which with the number resulting to 181. Under the foot and mouth control strategy, all properties with suspect animals showing clinical signs are conducted immediately in terms of collecting samples on serologically and tissue tests, of course, conducted from our own laboratories. The farm will then be put under quarantine and no movement will be allowed from that farm. And a 10-kilometer radius of the index farm is mapped out, and all those farms are quarantined and sampled. Vaccination will also immediately kickstart from the outside the 10-kilometer radius. Limpopo instituted a movement control for the whole province and shared with all provinces, although we're still experiencing some difficulties in terms of the roadblocks, which will then share this responsibility with SAPS, but will make sure that we strengthen that particular area together with the border management areas. But suffice to indicate that we do have the cameras that are installed in the freeways that will then be able to control the movement of animals from our province to other provinces. So we have the Joint Operation Committee in place, which sees in a weekly basis. And in terms of the next slide on capacity to address the FMD, including challenges, the challenge that we are experiencing in our province is the issue of the availability of sufficient budget. The scale of the outbreak affected all the 5 districts, and additional budget is needed to that effect. A business case was sent to provincial treasury for additional funds with no success, as the disease was only classified and not declared as a national disaster. The critical personnel for FMD control is mainly on veterinary services, animal health technicians, and we are also reporting that from the Limpopo province, we did not also receive the allocation from the national department following what the MEC has already reported to from Free State. We are also waiting for that allocation for our province. But suffice to indicate that from the red meat industry, there was not only on the animal health technician, but on the issue of the vaccination, there was a donation that was given to one of the farmers, of course, Sambata. The shortage also emanates to the veterinary technologists, veterinary public health officers, and animal health assistants and red line gates guards. The provincial veterinary services is then, we are at 341 warm bodies, and we have just appointed 36 animal health technicians. On the next slide, on the infrastructure maintenance, we are saying we report the 5 cold rooms that are refurbished in Giyani, Makado, Sibasa, Mokopane, and Lephalale, of course, by the Department of Public Works for cold chain maintenance, and also the vaccine and sample storage were also refurbished. On the resources pertaining to animal handling facilities, the province has 1,760 that requires constant maintenance, and a total of 604 have been identified for repairs and or construction. Repair and construction has been an ongoing project supported through the CAS project or the CAPS funding, and implemented by the community members in the main, the farmers themselves, and through the EPWP programs. But we want to indicate that the 1,760 animal handling facilities that are reflecting is not enough, and we're going to make sure that for this particular financial year, over medium term period, we must make sure that we increase these animal handling facilities, at least to make 1 animal handling facility per ward. On the resources on animal pounds, our province, like I've already indicated, that is bordering Botswana and Zimbabwe and Mozambique, large number of goats are smuggled from these countries and finding their way to Gauteng and KZN, hence the issue of movement control with the SAPs and the roadblocks is needed. As a province, we are facing a challenge when the animals are intercepted by SAPs and veterinary services because there are no facilities to keep them while the criminal cases are still underway. In the province, we have 5 animal pounds, which is Lewakomu, and it's not functional, Giyani, Blueberg, Makado, and Ephraim Mogale, and the Marble Hall is a private one. So the only functional pounds in the municipalities are in Blueberg, Makado, and Marble Hall, which is a private one. The entire Waterberg district, which is our epicenter, has no animal pound. Hence, we are saying, as and when our law enforcement agencies were able to identify those animals, as a result of them not being kept somewhere in the animal pound, which of course we should believe that it is the core competency of the municipalities to make sure that they have the animal pounds, because that in itself assists them in terms of the revenue collection, and we do the proper handling of animals for identification process with the ear tags, so that they will then be able to identify the owners, and also the brand marking the owners of the animals. On vaccination program, the province has received 831,824 doses of vaccine from Biogenesis, Barcode, Dolvet, and ARC OVR. The distribution of vaccine is on the next slide. It will reflect, and the booster vaccination will start in September 2026. Vaccine spillage is at 38%, equal to 2,705 doses, which is at an acceptable level. The next slide is on the FMD vaccination campaign, the performance. Our province is has vaccinated 627,137 cattle, which translates to 52.3%. So at least by the end of the year, we are cocksure that we'll then meet the 80% target as put by the National Department. And all animals is 703,647. The doses received or utilized is 706,354 with a 0.38 spillage, like I've already alluded to. And on a weekly basis, for 33 weeks, we were able to vaccinate 21,322. The numbers, of course, are disaggregated in terms of the graph below, which will include all the animals, including the pigs, goats, sheep, and the sector split by assistant type recorded per session. The next slide is where we are indicating the areas where the foot and mouth was concentrated, with the red dot representing those that are positive, and the orange one representing those that are suspects, and also the game, where we are indicating that we have Bapalaborwa there, we have Waterberg, which is a worry factor, also our Maruleng, due to the proximity of the wildlife, the Kruger National Park. FMD vaccine product utilization and the doses administered, the type of vaccine that we have received is reflected there, and also in terms of their percentage and the total number of the animals vaccinated, 7,006,352 with 100% performance or doses administered. And the numbers are also disaggregated in terms of the districts that we are having in our province. The next slide, I think this one is just the explanation of the terms on the National Livestock Traceability System used by the national province, which then indicates the identification and traceability system intended for use throughout the country in order to curb the disease, and also the usage of the CSIR to enable end-to-end traceability of animals across South Africa, with the issue of the 8-year tax that I'm not going to bother you with all this, but I'll then move to the next slide on the Leeds SA, the current status in Limpopo on traceability and vaccinated animals. The province records all animals vaccinated on the electronic online called the Survey 123 reporting system, where in the number of livestock vaccinated reflects coordinates per point and contact details of animals, including the animal owners that are duly recorded. All 706,352 vaccine doses administered across the province have been electronically recorded using the very same device, the electronic device Survey 123. The vaccinations were conducted and captured at 3,088 vaccination points across the province. For further traceability, the province also started to capture vaccination records on the Leeds SA, where each animal ear tag is linked to its owner, date and place of vaccination. And our province is also issue the vaccination certificate to that effect, when we are still waiting for the procurement of the ear tags. So the ear tags that we have since procured is 250,000, and the process to administer those ear tags will be underway once the process is finalized. The appointment of data capturers is underway, when we are required to clear the 30,000 animal upload backlog and sustain ongoing registration throughput. The movement control, I think I've already identified this, that we are issuing electronic permit and enhancing movement tracking control through leads as and when the animals will be going to the auction space and any other space, including the biosecurity measures that are taken in all your feedlots, your dairy farms, including the vaccination point where we are conducting the biosecurity measures. And on summary and way forward, we've got the shortage of RFID, that is the radio frequency identification ear tags, the one that I've said already, we have procured 250,000. We still need more. The wildlife infection, I've dealt with it at large. The human resource limitation, I've also alluded to that. And also no national standardized movement control. I've also alluded to that. And on mitigation, we're saying, as the department, we need to negotiate with Treasury for ear tags to be part of transversal contract. The matter has been escalated to the veterinary working group of MinTech. 36 animal health technicians are recruited in July and August, and we are still awaiting for that smaller number from the national department. The VWG, the veterinary working group, and the MTT, ministerial task team, are in the process of developing standardized protocol, and the Department of Agriculture is in the process to finalize movement control. As we conclude, we need to indicate that the pronouncement, of course, made by our political components, our president, on the issue of increasing the number of our extension services, I think it will, if implemented, it will assist us, because those our extension officers there are like our nurses and doctors of our department, and they will then assist us in making the work to be effective. Thank you so much.
Thank you so much, MEC, for taking us through your presentation. I can feel that it's Women's Month because all MECs we have presented this morning are women. Happy Women's Day, MECs, Happy Women's Day. Happy Women's Month, yes. Yeah. Okay, I'm then going to, you must prepare your technical teams because we are going to respond to questions. Honorable members are going to ask questions. You must sit next to your senior technical person. But if then, DG, some of the questions are directed to the National Department, yourself, and the DM is going to lead the team in responding to those questions, because I sense now that the work is cross-cutting from national to provinces. Maybe some of the questions will be directed to the department, to the National Department. Honorable members, I'm going to note hands now. You must just take notes because they are going to ask, they are going to be specific to say to Free State, to Mpumalanga, to Limpopo, but it's going to be one round speaking to all these presentations. I'm going to note hands now, honorable members. The first hand is Honorable Devald, followed by Honorable Ndalane, followed by Honorable Mxitama, followed by Honorable Mtetwa, Dabezethu khona. Yes, then uzayivala Honorable Trolip. In that, Honorable Mutaung, you are going to come after Honorable Trolip. In that sequence, honorable members, I'm not going to say you must speak in that sequence.
Chair, to Mpumalanga, I just want to mention the movement control, because in the presentation, the MEC said they trained them for movement control. So my question is, are you monitoring your training? Because you might not know, but I actually know Bushbuck Ridge and those areas extremely well, and your cattle is roaming the streets. So I don't know what movement control is in that area of Mpumalanga. And I don't want to go into that. I've got the same question on your primary vax that I had to the Free State and your booster vax, your secondary, after the 6 months of primary. How many did you do, or are you busy, or when are you planning it? Because it's got to be in a certain period of time. And then to Limpopo, my home province. You know, you've got a Pounds Act, MEC. It was Act 3, written in 2002, passed. And it actually, I don't want to read it to you, but the purpose is a mandate. You can mandate local municipalities to establish and maintain physical pounds for, to manage our stray livestock. Now, I know those cameras that you're trying to catch it out, but I can show you photos up to yesterday on a daily basis. The cattle is walking on the N1, one of the busiest highways in our country. All the traffic from Gauteng, Northwest, Africa is on the N1 North, but you find the cattle there. And that's not only where you find it. And the Bella Meyer will tell you, she actually said Waterberg District has got a pound. There is, in your presentation as well, and out of my knowledge, there's not a single pound in Waterberg. If it wasn't for the vets monitoring that, and there is very good biosecurity control by private vets, mainly. We have two very good state vets as well, I must acknowledge. If it wasn't for them to protect the cattle and our game, because you didn't mention the buffalo, African buffalo thing, how the Kruger Park is a big thing. You mentioned it here at the end. You didn't speak about it in the beginning. So there is no movement control. If it is not the private vets and farmers, then there isn't. So why do you have legislation if you can't get it implemented? And do you have any cooperative governance agreement, working relationships? And remember, I was in the legislature for 3.5 years. With Treasury, with Koksta. Why aren't they helping us? The municipalities is doing zero. And we rely on private sector to help us. And we know that our state vets are also overburdened as well as the others. So I'm very interested to see how this intergovernmental relationships is going to help us keep Limpopo, who's on the border of the Kruger Park and Africa, as you said. How are we going to get through this? The biosecurity, not only the movement, the dipping, etc. You can't have rules and laws and municipal bylaws, by the way, but it's not monitored. So what's the purpose of this? Chair, and I'm going to leave it there because I've got a lot of things that I can list for every province, but I'll do written questions, and we'll see what comes out of that.
No, thanks, Chair. Let me start with the Free State, and then on the outbreak status and data. What is the current number of the confirmed FMD cases in the Free State? And which municipality are still in a hotspot? How often is case data updated and made in public? And then on the vaccinations, the booster, I think, has been covered by Honorable van der Walt, that being done, and how will farmers be notified on the boosters? Reporting and enforcement, how can farmers report suspect cases, and what happened after a report is made? That was the Free State. And when we go to Mpumalanga, is that under policy and in supply, when is the next batch of the vaccine arriving, and how will allocation be decided? What is the plan to address being the sole or supplier or bottleneck? And then under the strategy, what are the criteria for lifting or expanding diseases management areas? What is the national communal communication plan for communal and commercial farmers. Limpopo, I think you raised the issue the budget because you don't have enough budget. Fortunately, DG is here, National Department. I think that's they have to address that thing because Limpopo is just right in the rural area, and without the budget, there's nothing you can do. So, department, please assist the province and other provinces that really they're having that shortage of budget. And what is also the current number of confirmed visa suspect of the outbreaks in each district, which is Limpopo? What is the status of the trace back and the trace forward from the last 30 days? On the under vaccination and resources, how many animals has been vaccinated per district to date vice target? Do you have enough vaccine stock and cold chain capacity for the next campaign? And what are the challenges you are facing with receiving delivery of communal areas? I think beside the budget, it's, you can just tell us about other challenges so that the department can still, and the committee will make a follow-up on that. Thank you very much.
Thank you, Chair, and we appreciate the presentations from the MECs. Now, for Limpopo, the issue of the African buffalo has been raised, and I'm just checking in terms of the border security and management. To what extent have we resolved that matter? Because the popular perception is that we have a porous border. Are we able to control the movement of animals across the border? And these two questions or three will be repeated with all the other MECs. The first is, do you envisage a resolution to this problem? If you're sitting there, you're making the interventions and the plans, do you see an end to this foot and mouth disease calamity? Because we have been at it for a little while now. Then there is the silence on landlessness and its impact, particularly for communal areas, because farmers, they must share grazing spaces and there's pressure for land. So what is the impact of landlessness into the creating this problem and sustaining it? So in other words, shouldn't we be looking at resolving the land question as part of the solution to this challenge? Then there is the issue of penalties for transgressors. The last time I checked, there were very low penalties, but also just to get a sense of whether any transgressors in the respective provinces have been ever found guilty, made to account, and if so, what kind of penalties have been imposed and for how many transgressors, more or less? Thank you, Chair.
Thank you, Chair, and greetings to MECs and officials and our fellow members of the Portfolio Committee. To complement the question raised by Honorable Mkletama in terms of landlessness, FMD is a national question now, and it was even declared as an emergency. So the following needs to happen. During the departure of the 4 trekkers from the Cape in 1820 to Free State, seeing that we have Free State now, they then removed the Basutus in Free State to settle themselves, the 4 trekkers. Not yet. I'm not yet on Orania. I'll come to Orania. Oh, okay. So the Voortrekkers, when they left Cape region in 1820 to settle in Free State, the reason why it's called Free State is because the British said that go far away beyond Vaal River and you settle there if you don't want to be under British rule. So I'm raising this historical question because FMD is actually teaching us a lesson of what we must do as a matter of national interest. And this is it. Since the Afrikaners removed Basutus in Free State, they did the same thing in Mpumalanga. They did the same thing in Limpopo. The reason why now we have what we call communal farmers who happen to be blacks, they are not white. It is a calculated and structural systematic arrangement which we need to address now as a national emergency question. And why do we need this issue? You must quarantine. You need to have land. You need feedlotting of these animals. Then you need to expand because there's a threat of food security. So these are all issues of Agriculture Portfolio Committee, but they are now affected by FMD. This is what we need to do because the same laws the Afrikaners use are still active. We are still using Roman, Dutch, and British law. I will raise them. One, the 1913 Land Act, when they removed the African kings. Then the Forced Removal Act in 1955 during the apartheid regime. So it was the British regime, Union of South Africa in 1913, and then 1955 during the apartheid regime, and then 1975, the Expropriation Act applied by the same Afrikaners when there were national interest issues. Here we are in the democratic dispensation, we have a national crisis of FMD. And in the interest of Sakelika case, wherein the African commercial farmers are taking advantage of the authority of the state, exclusivity, to say they must share in them importing vaccine, we would like to also come in the same vein and say we would like, in the same spirit, that Expropriation Act be evoked, wherein we expropriate land. In Mpumalanga, MEC, you move from Gatsibande, I'm from Utrecht, so I know your province very well. From Gatsibande, you're going to Gauteng. There is a vast tract of land that is sitting there unoccupied and sometimes not actively farmed. It's said to be belonging to white commercial farmers. Then your people, you go into Emalokshi, Standerton, and all of those areas, they don't have land wherein they can quarantine, they can do feedlotting, they can observe the protocols of FMD. So it means it is a national crisis. So how do we address it? Evoke Expropriation Act, which the president signed. Don't worry about those who are opposing it. The president has signed it. Now that it is signed, during the FMD, we need to evoke it, apply it now to address the national crisis, unless somebody has a problem with that, unless somebody doesn't see a national crisis in that. I will show you why the movement of animals and people. When the Afrikaners arrived in Free State, they pushed through the Batlokwas, and the Batlokwas had to move from Free State to Limpopo, Gamachak. We now have...
Honorable Mtetwa?
Yes.
I would request that maybe you don't lecture them about the movement end. Maybe just zoom into the presentation, ask questions or make comments based on the presentations that they've made, so that we are also going to give other provinces an opportunity to speak.
They didn't address the issues. Your presentation didn't address the Expropriation Act, Land Act, and all of that.
When
right?
we are going to have another agenda item that is going to speak on those issues. Today, we are only focusing on FMD, not expropriation.
FMD is needing land response.
No.
We need land response. We need quarantine facilities.
I hear that. I don't want to cut you, Honorable Member. Just ask questions based on their presentation, because they are not going to be in a position to respond about land issues.
And comments as well.
Because the item here is clear. It's FMD. Progress, update, challenges. So just ask about those issues, because it is not going to assist us to ask them questions that they are not going to be in a position to respond to.
You know already that they won't be able to answer.
I'll respond lunchtime.
Okay, fine. But I've addressed my point in saying then that you made an issue of Utrecht, 22 cattle. I'm from Utrecht, literally. So those cattle that you said on February were taken from Utrecht in my area, and they moved to Mpumalanga. The question that we need to ask is, if it's a national crisis, the issue of FMT, how do you then resolve by saying the FMT that was contracted, which you picked up, was as a result of animals that were taken from KZN Utrecht when this thing is spreaded throughout? Which means, where is evidence before the contraction of FMT on the date that says what was the status in Utrecht versus what the status in Garsibande? Because there's a border town. Utrecht is a border to Garsibande in Mpumalanga. So if you can give that evidence to say there was zero infection in Garsibande, it is only exacerbated by the 22 cattle that were moved into the other province from KwaZulu-Natal, then we can then say that the Utrecht cattle were actually a reason for the effect. So we need more detail on that one. Then in terms of Limpopo, most of the land is in the commercial farms. Now, where is land which you can set aside for quarantining purposes, for communal purposes? And I need this one, this applies to all MECs. When you give a national or provincial herd numbers, you need to then disaggregate them according to communal versus commercial, so that we check whether your intervention of bringing vaccine was addressing commercial farmers more at the expense of communal farmers, whereas the need is more on the communal side, which eventually are actually the ones who are having a lot of protocol problems that may result into a national spread of the vaccine. Thank you.
Thank you, Chair. Deputy Minister or members and the MECs. Mine now is no longer going to be a question, but it's just around the comment and concerns around the fact that if one looks at how livestock or cattle is being controlled in all provinces, it's a uniform control, I would say, because you find stray livestock on our public roads, on our national roads. It gives a challenge to maybe those who are responsible for implementing or applying the laws of the country. The issue of the livestock, what I call pounding sections, it gives a challenge to as well the control by law enforcement agencies to make sure that the livestock does not move from one province to the other. MECs, I think, in all, as I've been listening, have one and the same problem of the usage of grazing land for communal farmers. The challenge, as Ormteta has just been raising, is that of not enough land for communal farmers to have their grazings. If one may then be on the question to say, what are the departments, 3 of the departments, what are they doing to engage rural development to go for buying farms for these livestock owners so that they could maybe have a controlled sort of way of dealing with the FMTs, because obviously the spread is with regards to that the sharing of grazing land by communal farmers. The cooperation with the game owners, where we all detect that buffaloes are the carriers of the FMD. What do your departments do to engage game owners with regards to I'd say, the implementation of some sort of the buffaloes. I understand they have the ability to dart game, to dart elephants and all that. Why is it not? Why can't you, as the different departments in the provinces, engage game owners to make sure that they dart some of their buffaloes and give them the vaccines that would be required in order to reduce the rate of FMT, like the case was in TB buffaloes. We have learned that in some big game reserves, they managed to dart buffaloes and took away the calves before they were infected with TB. So as to reduce the number of buffaloes carrying TB, why can't it be the case with FMD? That would be my concern, actually. I'm not questioning, but I'm saying those are the things that maybe the provinces could be doing. The engagement of law enforcement agents, I must still stress. I'm seeing over the weekends when I'm home, people transporting big goats from Limpopo, from Mpumalanga, from Northwest to KZN. There's a big business now of goat, goat business in selling. These people don't mind. They go with obstructing the laws that say animals should not be transported in the evening. But you find this livestock business is now going up and down, even in the middle of the night. You find people pulling the trailers with their goats, with their cattle across the provinces. Maybe the provinces should make sure that they engage much with the officials from Agriculture Department, the Road Traffic Inspectorate, the SEPS members, in order to control or to try to stop this bad approach and attitude by some people who are only worried about getting more money, not giving them on making sure that the FMD is not spread all over the country. Lastly, if I could, the MEC from Mpumalanga talked about the slaughter of cattle. I'm not sure whether the minister was saying these cattle that were slaughtered were for human consumption, or maybe they were, they were culling them in order to sort of reduce the rate of the number of animals that are found to be carrying this disease amongst the livestock owners. Yeah, I think I should. Or the issue of tax, maybe to the Deputy Minister, if I may direct it. Minister, the issue of ear tax after vaccinations, in some areas you find that there are no more tax. Who supplies the tax? Where do they buy from? Is it from by the provinces from different co-ops, or the department has a specific supply of the ear tax so that they could buy and supply the provinces in order to maybe easily identify? I'll put it on my case, Deputy Minister, from the north of KZN. I'm sure still the MEC will be coming maybe before the committee. But what I've learned is there are no more tags available. As a result, if animals are vaccinated, they only need a livestock owner's ID number to say it is known that that particular somebody had driven his livestock to a hanging facility so that they could maybe.
Now, Kulu, please lift your mic, yes.
Oh, Pepesa, Hlalwana. Kodwa uzwile uDeputy Minister ukuthi bengithini. Ngoba she's a farmer as well. But anyway, the issue of the shortage of ear tags for livestock in order to be identified as treated animals that have gone through the process. Angime Hlalwana ngiyabonga.
Yeah, I hope that, Chair, I hope that the ministers are going to be able to, or MECs are going to be able to get all these questions. So I'll be as brief as possible. In the report from the Free State, it does state how many commercial cattle have been vaccinated, how many communal cattle. But in the original report that we got, in the one section, it was confusing because it says, of the 729,000 animals that have been vaccinated, 54% are from commercial herds and 45% are from commercial herds. So they both indicate as commercial. Can we just get an idea what the proportion is commercial versus communal? I also noted in the report that it said that commercial vaccinations were 63%, and communal vaccinations made up 32%. And in Limpopo, it's different. And in Mpumalanga, it's also different. It's gone the other way, more communal than commercial. So maybe just an idea why that proportion is so high in the Free State. And I note, MEC, that in the Free State, 56% of vaccinations have been done by the departmental vets and AHTs, and 46% by animal health technicians. I mean, by private vets. So that's a really good indication of a private-public partnership that is working and that we are combining every available resource. Can you just tell us how you've managed to get it, that kind of buy-in? 44% vaccine coverage, MEC, are you confident that you'll make the 80% target by the end of the year? Because the first 44% is the easy part. It's the next 56% that's going to take a lot longer and be much more difficult to reach. What is the role and relationship that you have with RMIS? Is there a contractual obligation that you have with RMIS in your province? And then I note that with LITS, Livestock Identification Traceability, you've had training, but you haven't been able to implement. Can you give us a reason why that's not happening? To the MEC for Mpumalanga, I have one more question. Can you just give us some more clarity about the outstanding BVI purchase that you have for, I think, 18 million, you said? Can you just give us clarity on that order that is outstanding and that has been placed for BVI? Then with regard to Mpumalanga, same thing. Could you please give us an update on the LIT system, where you say you've been trained but not funded and no rollout due to lack of resources? And you also said that you are using the SAFAIS system, but you're going to integrate it into LITs. When and how are you going to integrate that? Because if you're using different systems, it's very difficult to keep a handle on what you're actually doing. And if you can't measure it, you can't manage it. Also to the MEC for Mpumalanga, do you have a formal relationship with RMIS, and what is that relationship? And then, are you receiving your vaccines directly from service providers, or are they still coming via OBP? And I have difficulty in correlating the totals that you gave us in your report that you presented on in the report that was given to us. So if we could maybe talk to the fact that it's difficult to correlate. And then the MEC of Limpopo, I see that there are 181 lab results outstanding. Can you give us the time frames or how long it takes to get a lab result back? Because if these are not being processed quickly, we're not going to be able to respond adequately. The MEC told us that in Limpopo that they are cooperating with SAPS, but many of the members said that there are no roadblocks, there's no checking of livestock movements. Border management, the MEC made reference to border management. We know that our border management is parlous and that humans and animals cross our borders on a daily basis, and it's the animals that are problematic, wild animals especially. Camera controls on freeway. What's a camera going to do? The camera is going to take a picture of a truck with livestock on it. It's going to go past on a freeway, and it's going to end up somewhere. And by the time somebody responds to that, that livestock's offloaded and gone. So can you please give us an idea of what you meant by camera control on freeways? And I think for all three of the MECs, Chairperson, the issue around the national disaster classification versus declaration is problematic, because all of them have referred to the fact that they can't get ear tags and that they can't implement LITS because National Treasury is not moving on their behalf, because there's been a classification but not a declaration. Which brings me to the ear tags. I note in the MEC's report here that says 706,000 doses have been recorded on the Survey 123 system, and that you issue vaccination certificates, that you've recently purchased 250,000 ear tags, RFID ear tags. When they come from the tender, how are you going to identify the animals that were vaccinated? If you don't ear tag an animal when you're vaccinating it, it's impossible to go back and do it ex post facto. So how are you going to apply ex post facto application of identification of animals that have been vaccinated? I think I'm covered, Chair.
Thank you so much, Honourable Trollip. Honourable Smith, do you want to raise some questions or comments?
Thank you very much, Chairperson. Apology for joining late. Out of constituency period, my constituency don't want to let me go. Yes, thank you very much. My questions would be specifically in terms of the responsibility of provincial governments with relation to movement control, which has been really problematic, and I think it has been raised also now by other members in Limpopo, in terms of not a single roadblock that I came across. In fact, the areas where there was some kind of biosecurity implemented, on roadblocks where they spray and what is in terms of farmers and also what do you call it? Plaaswag, I don't know what you call it in English. Yeah, like that is cooperating, that's doing that. But I haven't seen the department in Limpopo, for example, of that. Then also the matter around monitoring via cameras, I also saw that, and that has been the communication from Limpopo throughout, was that specific, that they use that strategy. But we don't see any response unit, if they pick up on camera in terms of acting on that. And then we know, on the N1 that there's a lot of movement. I mean, there was some examples of illegal movement of animals that happened on the N1, and there is way bridges on the way. How do they pass that? How do they pass those checkpoints? Wasn't there any collaboration between the department and the traffic, provincial traffic department to make sure that, those checks and balances go? Although I know there's a serious problem with corruption, where people are stopped and then pay a bribe and continue. We see that with the foreigners that's transporting goods, through the border, that's far overloaded. They stop, and then they just continue with the overload to the next one. So it means that there's a serious problem. that is not going to help either, because people will bribe if they know they've done something illegally. The second question I have is in relation to the communication between the provincial department and the various districts. And I had some examples, for example, in the Free State, where I was contacted, where in the farmers were looking for vaccines in a district, and then the district says they don't have stock, while the province say, but there is stock. So in terms of that gap in between, and you know, holding officials accountable at that level, because it seems like some either is neglecting their responsibility, or somebody's being highly dishonest, okay, or some kind of sabotage. I don't know, but it is questionable when you get, you know, two different communications coming from one side to the other. And then, you know, in terms of consequence management for people that fail to do what they're supposed to do, because there was significant failures at provincial level in terms of implementation of vaccination and biosecurity and movement control. Because the vaccines came in, and it was cascaded down to ground level, but then there was a lot of hiccups there. So in terms of holding people responsible at that level. Thank you very much.
Thanks, Chair. Chair, I'm partly covered by my colleagues. Let me also join other members by welcoming the presentations. On Limpopo and Mpumalanga, I did not hear your presentations, MEC, talking to challenges that you are encountering with regards to neighboring countries that are near your provinces. Maybe I've missed that part. On Mpumalanga, MEC, I just want you to confirm that we have proper records of a vaccination program that we had. I heard one disturbing statement from you. On the Free State, Chairperson, let me also welcome the presentation from Free State and applaud the MEC. That I saw the presentation, very informative. If you follow it, you'll get all the answers that you want. But again, I also want to encourage the MEC to do more. MEC, you did good work during that process. I can confirm that it's my constituency, one of the programs in 2 regions, district, I able to attend those programs that we are busy with during the vaccination processes. Lastly, MEC, you still have challenges of overcrowding in different municipality communal camps. I know it's not the department problem, it's a problem of the municipalities in implementing their bylaws. But unfortunately, that challenge, it comes back to the Department of Agriculture during this time when we have these different diseases, having animals that are roaming around the towns. I don't know which strategy can we use or which relationship can you develop with municipalities in trying to resolve that problem. Chairperson, to the Deputy Minister, I just want to check is there any assistance, funding, support to farmers, especially emerging farmers, in helping them to comply with LITS requirements, because it's important for farmers to comply with it. Lastly, Chair, there is an urgent need to bring the Department of Land on our agenda so that we deal with, we hear the update report on how far or how urgent are they assisting our farmers who are in need of a land. Thank you, Chair.
Thank you so much, Honorable Member, for raising those questions. I hope my MECs, together with their technical teams, they've been capturing those questions. If maybe they are somehow not in a position to respond to some of the questions, they must provide those responses in writing, but they are going to indicate during the response time. Honorable members, I've just received a notice here that the representative of Food and Agriculture Organization in South Africa, Dr. Babachana, I don't know whether I'm pronouncing that correctly, has sadly passed away. He is one of our advocates who are committed to Food and Agriculture Organization, work in South Africa, and is well known within the sector. Let's rise to pay respect to our one of our own. From my side, I'm going to echo the same sentiments that honorable members are raising in this meeting. I'm not sure whether is it the same picture that we are going to come across as we continue to receive presentations from various provinces. Because what I'm observing is that the outcries on the LIT system in all these provinces that have been that have tabled their presentations, of which we need to understand, honorable members and DM, DG and your technical team and MECs, that the absence of fully operational livestock traceability system remains a challenge, and effective disease surveillance, animal movement control, and rapid outbreak response depends on a reliable, traceable system. There is something that is confusing when I looked at the presentations. Limpopo is having a detailed information in relation to National Livestock Traceability System. You can see they have about 3 slides. It means in Limpopo they are trying, although there are limitations there and there, but they are trying. It's like they are getting support. When you look at the presentation that has been tabled by Mpumalanga, they are even saying, as Honorable Trollip has already raised, the LIT system has never been rolled out throughout the province due to some resources that they were having constraints on. I would love the department DM and the DG to just provide us with some clarities. What are the hindrances and what are the mitigation measures that they are putting in place to address this challenge? And when you pick up from the presentation from Limpopo, it is referred to as a pilot project. When is it going to be operational? When are we going to expand our footprint to ensure that it covers the entire country? If there are problems or challenges, what are those constraints? And how best are you going to then address those bottlenecks to ensure that it is indeed rolled out throughout the country? I'm going to start with you, DM. You respond to those questions that you are in a position to respond to. Then you delegate your technical team to respond to those that you believe you need to respond to as the national department. And then from there, I'm going to give an opportunity to MEC of Free State to respond. If you feel that your technical team must also add, MEC, feel free to do that. In that sequence, members, I'm not going to say you must speak in that sequence. Over to you, DM, with your technical team and your guests and our guests.
Chair, can I please, through you, allow the DG to respond to some because they are very much technical. The availability of tags, are they being sold by private sector or are we supplying? And many of those I'll then take over when he's done. Thank you very much. With your permission.
Honorable Smith, I'm quickly going out. Please assist me.
Okay, can continue.
Thank you very much, Honorable Chairperson and members of the Portfolio Committee. There are a few questions that are relating to the National Department, and I think that I will try and move swiftly through those. Now, one of the critical areas that was raised by the members was around the Pounds Act and the relationship between the provinces and the municipal areas where they are. This is one area that is very important in terms of ensuring that we have got FMD under control. And there have been discussions at the MEC around ensuring that the Pounds Act is being enacted just right through all the provinces to ensure that animals that are impounded are able to be put in a place where they are. Unfortunately, in terms of impounding, we also have got citizens at some stage who also try to impound, leading to unfortunate incidents like the one that we had in Madibeng over some last week, where one farmer was actually killed because of impounding animals. We are also having this issue around that was raised around the tax and how leads comes into play. Honourable members would recall that there was a request for the department to come and make a presentation here on leads, and we will be making that presentation. And that presentation would clearly outline where we are in terms of leads and how do we expand on leads as a program. Honourable members would recall that the department had the CSIR to develop leads, and we have made strides in terms of that, and we'll be able to make that presentation without forecluding what the presentation would be making coming through. Now, there is a matter that is being raised around the labs. There are 181 outstanding results coming from ARC. We are currently, as the department, trying to get additional labs that would assist us to deal with FMD, especially around diagnostics. And we are exploring 2 more labs to see whether they cannot be able to assist the ARC, because at this moment they are swamped with the request with samples and also the request for the results accordingly.
Sorry to do this to you, DG. We've heard that before. We've heard it a good few months ago. What is the progress with engaging these 2 new labs? We can't just keep hearing that we've engaged 2 other labs to help with the backlog, but the backlog gets longer. Thank you.
No, thank you. Through you, Honourable Chair. The 2 labs were visited and they were found to be non-compliant. And the non-compliances that have been looked at by the unit in our system are being rectified so that we can deal with it. So it's an issue that we are dealing with a control disease, and their expectations in terms of the control disease that any lab that handles that material should be compliant to, and that's what is being looked at through you, Chair, through Honourable Trolip in terms of that response. Now, there's an issue that is being raised, Honourable Chair, relating to the declaration in state of A classification. And this is something that the Honourable MECs have been raising quite a lot, and we have also been raising
and would be taken through with National Treasury and also with COCTA to ensure that this is a realization. That realization would assist us to have more funds that are moving into the sector. Because at this moment, we're really almost stretching whatever that you are having. And it's very difficult because the vaccines as they are very expensive on the system, and therefore you're only concentrating on what you can afford at this moment. And the declaration would be able to assist us then to move to a level where we can be able to address the areas sufficiently. Because for us, control measures relating to FMD are not only about vaccination, they are broad-based. They include controlled movements. They include ensuring that we have got quite a number of measures that are going to be supplementary, if not complementary, to ensure that we deal with FMD. Lastly, through you, Chair, the question that was asked around how do we handle the procurement for ear tags outside of the lead system, it was raised at the recent MEC, and we are looking at funding how can we assist the provinces that are not in a position to address that system, and it was raised at MEC. Thank you very much, Honourable Chair. With your permission, DM.
Thank you very much.
Thank you. Before we go, I just want to add back to the chairperson. Thank you.
Indeed, I think chairperson and the members of the portfolio committee, there is a need for the department to amend some of our policies because there are changes that are taking place. Not supplying tags become a matter now that people take an advantage that whether you have tagged or not, or you have a reason you don't have tags, has become something that disturbs the processes within the farming community. The livestock theft is becoming worse, and I think it is also because of the absence of tagging, as much as that we are trying to actually support provinces for animal identification. But I think the system also does have a little bit of a problem because the forms are actually issued after you have actually identify your animal. And the process between a province and national for the certificate to reach you. So I think in the process of wanting to be quicker in the process, because police, when your animal is not identified, they don't start looking at it. There's no case at all. And therefore, we have a way of together in the MEC, as we make a lot of improvements in working together. But to go back to a question about the support that must come from local government, I think COCTA has moved a little bit forward to ensure that services of farmers in a rural space depend mainly on the local government, which has been prohibited to spend on that aspect. But today, due to the district development model, we see local economic development within a municipality able to support farmers, to hold meetings of the farmers, and also the budget for rural development is also supposed to, I won't speak on their behalf now, but I'm recognizing the fact that rural roads, roads to dipping tanks, roads to fields where people produce are also funded towards that option of the local municipality being deeply involved in farming. But at the same time, we'll learn step by step, though we are almost late. I remember a conflict when a municipality had provided a pond, a pound. Then the farmers, I went there to rescue farmers, but our farmers were on the other side because they were refusing that this pound be used. They were saying it's a way of wanting them to pay. But it was already there. But I think, therefore, in fact, the speaker was there to hand it over to the farmers. The farmers were not taking it to be their responsibility. So I think a lot of education will also go in terms of awareness and ensuring, and that communication must not only be on the side. You know, farmers in rural areas have now developed an attitude that says we are not in favor and honestly supporting them, except that we want to get also something from them. And I think we will have to have this engagement. They are very good when you take them to the dipping tank, and also them raising their matters. I think we are trying to involve all farmers equally to a level where we can work together as a team. Also to say we actually appreciate the support we get from traditional leaders, because if anything that has to do with livestock, grazing fields and all that, if it enters through their offices to say, Mhlegas, can I have your people that are in agriculture to sort out things? They themselves sit there and actually run the meeting very effectively. And then the district development helps because the other issue was non-cooperation within agriculture in terms of units and branches within the department, where they think that if you are an extension officer, you mustn't worry about the health of the animals, because there is a national department that has to do with health in terms of the stock. But you can't be an extension officer and refuse to extend information about health of the animals and the times they should be vaccinated for all the other diseases that are there. But now that this awareness that came, unfortunately, through this foot and mouth is also helping, because now people know that you must inject for animal, maybe African horse disease, then after that you will do this, so this vaccinating matter has become a preoccupation. But I think also we need to be more closer to ensure that we are working very well. But to agree with you, Chair, on the matter of land for animal and land for production, food security, we are having an ongoing meeting. After this week, we will be having a interministerial where we are able to sit together with COGTA, as well as the House of Traditional Leaders, that is a team, and then the other relevant departments, particularly Department of Environment, because soil erosion, land care should be with us, because we must care for those grazing pastures. We must be able to fence them and so on, but programs are taking long because it is with rural development, the issue of felt management, wildfire controls, etc. But indeed, the next report, Chair, to your members of the Portfolio Committee will be more organized because now we are able to pick up what we need to do as provinces are being asked questions. Those questions indirectly also come to us. Thank you very much, Chair.
Thank you so much, DM. We are going to move to the MEC. MEC Rockman. She's going to be followed by MEC Mokwetsi. Then we're going to end our discussion with responses from MEC Kekan in that sequence.
What time are we breaking?
The food is not ready. We are still sorting out.
Not about food, it's about meetings between lunch. Lunch was supposed to be at 1.
Okay, because yeah, they almost done. Let's just take a break. We are going to get a chance then to prepare responses so that you provide us with comprehensive responses. It's going to be it's 1 to 2, right? Yes. It's 1 to 2. We're going to reconvene at 2 o'clock.
Sorry, Chair. We specifically asked to be released by lunchtime. We need to get to the airport and go back.
Honorable members, would you mind to allow them to respond because my team is telling me that they requested to leave after lunch, hence the program indicates so. They've booked flights and so would you mind to just squeeze them in? We allow them to respond so that they are going to then fly out. Can I get, oh, we good. Perfect.
Thank you, Chair. I'll try to be comprehensive but brief. The current number of active outbreaks is 247, with the suspect outbreaks at 289. Our district hotspots is Mangung, the 3 towns, Lesweli-Putswa is Tokologo, that's Hartsogville, Boshoff, Deelsville. Then Gariep is Mokari, that's Roeville, Zastron specifically. Tabenfutsinyani is Dishlabeng, that's Bethlehem area, and Kitwana Rights area, and Mansopa, Lady Brand. And then Fizili Dabi is Mukak, it's still the Kroonstad area. We release our statements every Friday. We release public statements. When it comes to the land question, we do work with the Department Land of Reform and Rural Development, specifically in the case of Mukaka, Kroonstad. The municipality has no alternative land to allocate to commonages. So we are assisting them to make the submission to Department Land Reform and Rural Development. We've looked provincially, there's pockets of land but not suitable for agricultural purposes. So the pockets of provincial land is not going to assist them. With game owners, we do not intend to vaccinate game. We don't even have enough vaccines to vaccinate livestock at this stage, let alone game. So we vaccinate around the buffalo farms and we encourage the game owners and the farmers, their neighbors, to work together so that they have their animal movement under control. On movement control, I think in the previous presentation we outlined the different circulars that SAPS has issued, as well as our community safety, roads and transport. The reality remains that we do not have the numbers of vets or AHTs to go and assign to roadblocks. The police can check the documents, but they are not trained to check the symptoms. In addition, the illegal animal movement does not move between 9 and 5. It moves after hours. We rely extensively on our traditional leaders when it comes to Tabenfutsinyani, that portion of the border of KZN, and the district farmers' unions or farmers' associations. Although they are not allowed to set up roadblocks, we've said to them, call it biosecurity checkpoints. No one is going to ask a question. To try to maintain some sort of control over the movement, but our main problem is illegal movement at night. And we cannot patrol a whole border. I'm talking Lesotho borders, 486 kilometers, as well as provincial borders. It is virtually impossible. Someone asked, an honourable member asked about transgressions. Yes, indeed, we have prosecuted one farmer in Heilbron for refusing our vets access to his farm. He pleaded guilty and he was fined 3,000 rand. He paid the fine. The issue with fines is we forget that we need to engage with Department of Justice as well, because our chief magistrates must approve the fine lists. So the fines look like they are minor, but that is the process that was followed. When it came to this, AFASA did raise, and we thought it was quite a valid point to say, but let us not criminalize poor farmers who cannot afford the biosecurity measures, who also must make a living. So we must be careful to strike a balance. We cannot criminalize the poor in this FMD disaster. The vaccination by production system is in slide 22. I think previously we've also indicated in the Free State the pattern is different. We have more cases on commercial farms than on commonages. We must be very careful of this perception that there are stray animals walking around spreading FMD. There's no evidence to back that up. There is zero evidence to say there are any bigger risk than a commercial farm who brings in feed or whatever from any other place. They can equally also carry in FMD. The buy-in of the private sector, I think we've done continuous engagements since the first and before the first outbreak, when other provinces were already struggling with FMD. We have very constructive relationships with AFASA and Free State Landbou. We work with everyone, even individual farmers, the feedlots. I think our ability to communicate openly with them regularly and on any other platform, it doesn't have to be physical or we do virtual consultations. We are available. I think that has helped us quite significantly. We are quite confident we can reach our targets. RMIS, we have no contractual obligation with them. On LITs, we must remember Limpopo was the first province, or they were the pilot province for LITs, the implementation of LITs. So I think all of us can learn good lessons from Limpopo. We are waiting for DOA now to finalize LITs to be open so that we can fully implement. We have established a LITs office in the Free State. The availability of vaccine, the process is once you report the case, you apply, you go onto a list. We get our allocation from national, we allocate to districts according to our lists. You come in late and say, no, now suddenly I have a case. You're not going to be prioritized. We work according to our list of allocated vaccines. There's no unallocated vaccines. So where people are complaining is where the vaccines are allocated, vets are busy administering, but we don't have unallocated vaccines to just randomly accommodate people. What has also happened is some of our bigger commercial farmers, specifically in Tokologo, in that district, they sit with thousands of animals. They are genuine commercial farmers. They then complain, no, we are slow. Well, your option is you call your private vet and you pay him to vaccinate your X number of thousands cattle on your farm, or you wait for us. They're not prepared to pay for the vet. They will wait. We have a list. We follow the disease. We don't follow a system. I think the overcrowding and overgrazing in municipal camps where we work with municipalities currently is to help them develop profiles of commonages and that we do a redevelopment of commonage development plans. I think that is something that's an area that has been neglected. In the my earlier presentation, I forgot to mention that we are working with the IEC. We have developed a biosecurity plan for them, both for registration stations, the two registration periods we've gone through. A couple of our farmers have withdrawn their farms from being registration or voting stations, so the IEC will have to make a plan to have alternatives, and that biosecurity plan will also be in place in November. I think the AHT issue between DOA and RMIS, I've clarified. The BVI vaccine, we got 2,000 in July last year, and then 5,000 the 18th of July, 50,000 the 26th of August, 30,000 the 1st of October, 27,920 of January, and then 2,113 February. It's 117,000 in total that we vaccinated with BVI. All of the rest was either ARC, Biogenesis, or Dolvet. And then the minister just responded to a question about fencing. We will not support any fencing on any border. We did the border visit in 2024. SAPS, SANDF, the farmers, black, white, pink, purple, they've all told us, you start to fence here at 8 o'clock. When you get here at 9 o'clock, they have rolled up your fence nicely from where you started at 8 o'clock up to where you are. Waste of time. We must have alternatives. Yes, there's a need for some kind of something, but not a fence. We are going to spend millions and millions and millions, and the effect will be zero. Personally, I want us to look at going back to natural hedges, natural borders, stone walls. Even the KwaZulu-Natal, Mozambique borders seem to have challenges. That is also an option, but it is prohibitively expensive. We can impossibly put that on all of the borders throughout the country. I don't think it will work. So I think our best solution is go back to natural borders. Thank you.
No, thank you very much, Chair. No, Chair, we first want to acknowledge the comments that are raised by our honourable members. Chair, on the issue of movement control, we acknowledge that perhaps we still have that challenge in terms of the movement control, particularly in our townships and in our villages. But Chair, obviously, when you go in consultations with our communities, they will raise the issue of land. It has an impact, particularly in terms of keeping their livestock safe and to allow them to continue to graze. But Chair, we are continuing as a department to roll out these awareness campaigns, engaging our communities, working together with the Department of Safety. Chair, the planned date to start the booster vaccine is in September this year, 6 months period post vaccination. The next batch, we are not sure as a department, we are depending on our national department because they are supplying us. I think they will indicate when we'll be receiving the next batch. Obviously, we are focusing in Gatsibande because it's recently indicating that we still to pay our focus because of that high percentage. What else has been? The issue of land, Chair. As the province, we're tasked by the Premier to do the assessment of land that we hold in the province. We have done that and presented to EXCO. Now we are at the disposal committee where we are finalizing the matter. Obviously, some of the land has been occupied by our communities. We hope and we're planning that we give or allocate that to the municipalities. And perhaps we'll be leasing other land or giving to our farmers. But most of the land, obviously, is with our national department. Chair, in terms of the evidence that the honourable member has raised of the 22 cattles that were sourced from the auction, I think we will do that in writing, Chair. But then what do you call it, Konji Doctor? Forward tracing, Chair, was done, and it was found that even other farms that are nearby, they are cattle that were sourced from that auction, also they were infected. But we will forward that. There's a slide that talks about the commercial versus the communal vaccinated animals. I think, Chair, we have presented that as in Mpumalanga, the presentation that was before yourselves. Our cooperation with nature reserves, Chair, we once called the executive manager, and from her presentation, she indicated that for now they do not have an authorized vaccine that they use for our buffaloes. The only safety measure that they're doing now is to ensure that their areas are fenced so that the buffaloes do not go out. The animals that were slaughtered were used for human consumption, obviously with all the processes passed to ensure that they are free from the virus. The update on late, Chair, it was only piloted in Ehlanzeni, and they did not continue our national department. But from the engagement that we continue to have with them, they committed that they will source funds so that they support us as provinces. I acknowledge that, yeah, perhaps we could experience that difficulty in terms of integrating from the SAFs to late. Chair, we are pleading that, and we are pleading to yourselves that perhaps you assist pushing that as a Department of Agriculture we get more funds so that this is realized in our provinces. What else? The vaccine that we receive from our national department. We once received, I think it was a year before last, we procured as a department from OBP, which was authorized by our national department. I think it was last year when the former minister, or early this year, our former minister came to Mpumalanga, also invited the minister of Mozambique and Swatini, ministers of agriculture. They were starting sort of a regional engagement in terms how we ensuring that we curb the spread between these provinces. So we are hoping that they continue with their meeting, and there are resolutions that were taken or recommendations that will be coming us to the provinces that will implement. I'm not sure, I heard the honorable member there saying that there's a slide which does not, I'm not sure, indicate like proper records or something which has disturbed her. I'm not sure, perhaps if she can indicate that particular slide so that we give a clarity on that. Thank you very much, Chair.
Thank you very much. I'm going to accord our doctor an opportunity to respond to the questions.
Thank you, Chairperson. Thank you, Honorable MEC, members. Honorable van der Walt, Pounds Act. Yes, in the jog of Limpopo, we have Coxstar, we have disaster management sitting with us, who assist with this matter, and it's disaster. The whole water bed, no pound. And this is the cattle area. So they know about it. We are attending to it. It's being discussed there. Honorable Ndalana, budget, I think it's a problem for everyone. I'm not going to say much. In terms of confirmed cases, vaccine stock, and other issues, we have the updated. We can share it with you. Honorable Mngitana, BMA, border animals movement, yes, it's a big problem between us and Zim. Goats. Those goats move up to KZN. Actually, KZN, it looks like it's the preferred destination. 2 weeks ago, we arrested somebody with 39 goats in Marble Hall, almost leaving the province. Then, what do we do with the goats? He has already paid and is on his way to, he was going to Ladysmith. So we took the goats, put them in the private pounds, like the MEC said in Marble Hall. It's a private pound, it's not even our pound. We kept them there. Now we're sitting with a 33,000 rand bill We kept them for 11 days. The guy was arrested, was in jail. The case is still going on. Probably the fine will be in that region, the MEC said, 3,000 something. It's a problem, but we are also through the joke because also the NPA sits there that we want to review the fines list. Honorable Mtetwa, quarantine facilities in communal areas. Yes, the chiefs have given us land, basically. Anytime you can come. And we still have some of the old lands which used to be used as quarantine facilities during the homelands. They're still there. It's just to get funding and start this thing. And Honorable Tebekulu, game owners, do we engage them? Limpopo is the biggest disease-free buffalo area in the country. 52.4% of disease-free properties are in Limpopo and are in Waterberg. When the outbreak occurred in Waterberg, they were the first one to come to us to engage us. No. So what we do, we prioritize them with the dairy, and then we followed with them. Ring vaccination around the buffalo keeping properties. We vaccinated all those cattle around there. In all the areas of Limpopo, we vaccinated all the areas. But like the MEC indicated, we have 3 cases now of wildlife. In Bapalabora, roan and sable tested positive, and buffalo. In Bilabila, roan and sable tested positive, and also in Mudibone. It's a problem. We have raised it also with the veterinary working group and the MTT. They are looking at that. Eartags, who supplies them? I think the TGS addressed that. Any Honorable Trolip, Armes, Buffalo Analytics, we work with them in Limpopo. I don't want to beat around the bush. Armes gave us 30,000 eartags when we had nothing, and offered 2 officials and a vehicle to assist us in Greater Litaba and Nebo. We vaccinated and use all those eartags, and they're always there when we need something. Buffalo Analytics, they're assisting us with movement control electronically because they've got a good system which they use in buffaloes. We're happy, although there's other matters about the relationship. I'm happy to hear the minister saying he doesn't care who's got the system as long as it assists. And then 181 lab results outstanding. Yes, it's been a problem, but I can report that OVR has improved. Now we get results in 7 days. But we are even still getting results which were sent in February now. They are coming in droves. We have already done and vaccinated, but especially the serological results. The tissue results comes back very quickly. So we never suffered that much, but things are getting quite good. Cooperation with SAPS. In Limpopo, we work with them, especially the stock theft. They report everything. The issue with the cameras also, they are owned by the farmers. They are not owned by us or anybody. And we piggyback on them. And some of our officials have access to see those videos live, and we intervene. And once we get those animals, we apply for a destruction notice, and we take them to Palabora for destruction, meaning they go to the abattoir, they are slaughtered. The abattoir owner gets his money, and then we pay you the difference. At least we won't repeat it again. BMA, we work with them. They're also sitting in our jog. We fight. They say 10 kilometers from the border inwards is their area, but it's also an area where there's our animals. So we still need to find each other there. But we're working together. We've asked them for a pound or a holding pen somewhere in Denstad for those goats coming from Zim, because sometimes we struggle. One time somebody brought 88 goats. He was arrested. They were standing in front of the police station. What do you do with the goats if you don't have any? They were released to the owner, and they disappeared the next day. Honorable Trolip, you also asked about if you vaccinate without ear tagging, how would you know? That's why the MEC spoke about issuing of a vaccination certificate, so that when we come back, you show us the certificate that we vaccinated your animal so many, then we can ear tag them even later. It's not perfect, but it's something. And my worry is vaccinating the animal than identifying it, because we want to stop this thing. Remember, we're still coming for the booster. We can still do the ear tagging and put our systems into operation properly. Honorable Mtaung, challenges with neighboring countries. We have Botswana, Zim, and Mozambique via Kruger Park. Botswana, we good. And Zim, the goats. And the cattle which move around the river when the water is down, and including cars and stuff like that. It's scary, but it's bigger than vet services or agriculture. I think I've answered that, MEC.
Thank you very much. I think he covered all the questions, if not most of the questions, but suffice to indicate that Ndabezitha on the issue of the national question, we're going to make sure that, because as Limpopo, it's purely rural, with almost 80% of land occupied by the traditional leaders, and they try their level best to make sure that they assist us with the grazing areas. But suffice to indicate that with the amendment or the review of the statutes, as one of the portfolio committee members has alluded to, is very much important. The issue of expropriation without compensation. We don't need to take each other to the courts while we're dealing with the issue of the national question, so that you are then able to redress those inequalities. Thank you so much.
Thank you so much, MECs, for responding to our questions. I can see we do not have any follow-up from honorable members. By the look of things, we have responded comprehensively to questions raised. We just want to take this opportunity to thank you all for coming over to this, to brief the Portfolio Committee on Agriculture on FMD. We're hoping that there is going to be progress on your side as far as implementation, so that when we come for oversight and also maybe having a session in the near future, we're going to get some kind of improvement as far as FMD management is concerned. With those few words, travel safe back to your provinces. We're going to have a quick lunch, just 30 minutes. We're going to convene again at 2 o'clock.
Dr. Kabane. Thank you very much. Well, Chair, the question on KZN and goats should not be ended with FMD, because it's such an agricultural economic question that must be discussed properly. Because KZN is the headquarters of trading goats in South Africa. A goat that they pick up in Northwest at 2,000, the next day is 5,000 in KZN. If that's not properly discussed by agriculture, we'll miss the opportunity of KZN having to really become an economic hub, especially for Chevron, if possible. Thank you, Chair. Now, in terms of the numbers for the province, the number that is being used, it's 1.4 million. That's the head of cattle. And that number is attributed to FAO's statistics. It's always quoted as that, it's statistics from FAO, but nationally that's how I counted. Now, that 1.4, it means on herd immunity, it would be 1.1 million. And that would only be realized if it's times 2, which is 2.2 doses, and not head of cattle, but head of cattle will still be 1.1. That's what we have. Now, this slide is dealing with all the municipal boundaries in terms of first the outbreak of confirmed cases, and in terms of the number of confirmed cases per municipal boundary. Now, municipalities, you would see them. Very few are suburban municipality or metropolitan. In actual fact, it's Rustenburg, Madibeng, JP Max, and Matlosana. The rest of them, it's rural municipalities on the disparity that we have. That reflects the confirmed cases and the number of vaccination that you have. There on the summary, the next one, on latest cases that we have, 387, and closed cases being 89, suspects still 115, as you have. And on the sectors that are dominantly affected in commodities, commercial, dairy farms, stud farms, goats, it was minimal just in one village. We did not have dominant outbreak, especially on small stock. It was only cattle dominantly. So it was goats in one village and game animals in some areas that borders with game farms. On the issue of FMD control strategy, the initial strategy was based on risk assessment that was conducted. High-risk areas were outbreaks, farms, hotspots. Due to severity of diseases in dairy farms, they were prioritized. All cattle farms that are neighboring buffalo farms were high risk and also prioritized. Farms that are bordering international borders and other provinces, in this instance being dominantly Botswana and some parts of Namibia in our case. We did have a border vaccination on the 7th of April, done by the former Minister of Agriculture, Minister Steenhuisen, and the Minister of Botswana. We're planning another one with the National Department to do it again with Botswana as a dominant border. That's the one. Currently, due expensive spread, intention is to cover the whole province and boost primary doses. Remember, we're going back to a booster vaccine having captured the number that we have done. Now, on the budget, on DORA, we've got allocation of 182 million. On operational, which is goods and services, 26.5. On CASP for biosecurity allocation, we got 7 million. This was on the basis of giving extra for the processes of the response strategy. Now, personnel and expertise, the number of people we have and those that are expected to have. The first column is the number at present, the ones that we have. So on technical managers, it's 5 against 8. State veterinarians, it's 15 against 20. Control animal health technicians, it's 26 against 32. Animal health technicians, it's 86 against 90. Veterinarian technologists, it's 5 against 12. Veterinary public health officers is 9 against 11. General workers is 4 against 20. Data capturers 0 against 40. Now here is where the problem is. If you check general and data capturers, what it then means is that professional services and specialists are then expected to do more of administration work, because administration is literally non-existence. So a person who goes for vaccination, veterinary service technician, must come back and do data capturing on reporting. And that's one element that has been delaying us as a province in terms of updating our reports. Infrastructure, for cold chain maintenance, we do have Potch, Mahikeng, and Vryburg. And each state vet offices have got refrigerators that are used for local vaccine storage. Ramatlabama, which is National Isolation Facility, is almost dilapidated. 15 recently bought crash pens placed evenly throughout the province because of the challenge that was discussed earlier on, the challenge on communal areas, especially on handling facilities availability. It has been an element that has exposed us, especially during this period of vaccination. When you go, you must either have crash pens that are mobile, because facilities are almost close to non-existence in communal areas. That's the number of vaccine doses we have received and the dates and the allocation. What we have there down, it's 1.271,140 for the province that we have received. On the doses that we have received, that is 1.271,140. Those that were injected in animals, it's 1.1. Which means getting from the Free State presentation, because coming here I was not sure who's number one between us and Free State. Getting from their presentation, it means we're number one on vaccination to animals per province. Because we're expected to vaccinate 1.1 for 80%. We have done our 1.1 for 80%. Free State's 1.1 is against 3 million. Our 1.1 is against 1.4. That's why the difference is. That's why I could not declare yesterday when coming to be sure as to what is the number of Free State. But now it's clear. Free State, it's 1.1, both were 1.1. But ourselves were at 80% compared to them at 42%. We're 80% of the immunity, but we can only do that if we're to go back and vaccinate the still 1.1 full, as booster vaccination is starting in September. So the baton would be whether we are going to be able to go back and vaccinate all, as we've done now, Chair. That's the one. So we're at least a millionaire, but the worst part, I'm sure we're the worst performer on the vaccines that have been wasted. We should be worst performing because we're 22,000. It's way high, and it has been high on the basis of the principle on what we have opened, expected to use it. That's why we've been not doing very well, opening and finalizing using. And it's on the basis that we're vaccinating almost the remote areas. You could go open, vaccinate, they're not all there. You must then use that, and it's wasted in the period that is recorded. That's what we have. Now, the vaccination distribution is explained there. We have 4 districts. Dr. Ruth Khumutsi Mumpati, which is the side of Vryburg, Taung, and other areas. Ngaka Mudiri Mulema, the side of Mafikeng, Lichtenberg, dominantly your maize triangle. Bujanala, which is the Rustenburg area, Dr. Kenneth Kaunda, and then that's the whole of Northwest on distribution. Here, there's that thing that was a question of communal and commercial. If you check there, the communal that has been vaccinated is 352,649. The commercial, it's 545,865. Previously, there was a debate on land access and some element that was the responsibility of land reform. Now, because it's linked to communal, as a province, we do have a good working relationship with land reform. As a result, when we discovered that we are in short of animal handling facilities in communal areas, land reform did reprioritize from its budget to give us 54 million as a response to communal areas for animal handling facilities. The issue that is an issue of parliament and an issue of allocation is on access to farms, because you have a policy of expropriation with compensation. The number of farms land reform can buy is determined by the amount of budget they are allocated for. As we speak, I can talk about our province. We have no capacity to buy more than 10 farms with the money allocated to land reform for purchasing of farms. The issue is that those that hate land expropriation without compensation are still controlling through compensation on the budget, because the money land reform has is not equal to the demand of farmers to have access to land. In actual fact, who completely qualify for that access. That's why you are unable to intervene on commonage and communal farmers. They are overly supplied, even overly grazing on the basis of non-availability of land. That's an issue that must be balanced. Even if you were to say with compensation, then make money available equal to the demand. The problem is the money that is available. It controls the number of farms that can be bought in that instance. On vaccine booster and losses, like we've indicated by September, must go back, and we've explained our loss of 22,000 in that regard. On leads, as it was debated, the province is implementing leads with FMD vaccination. We did have a procurement. In actual fact, the difference between leads and remis is that we do have access to both as a province. Working with national, get access on leads. And then working with national, we got access to REMIs. But the only problem and challenge with REMIs is that its system, it's not advanced, almost like in LEADS. So there are components that you can register in REMIs ones, which are registered in LEADS ones. So the one of the LEADS is highly advanced compared to the REMIs one, but we do work with both as a province. The issue that I also wanted to deal with, Chair, is on the issue of the case. On the issue of the case, National must manage, I'm sure, because the Deputy Minister is here, National must manage properly the communication on this issue of the case. An assumption is created in public, and you hear the minister presenting. An assumption is created in public that all of a sudden there's now a resolution, and it's not explained that it was never an issue of refusal to distribute vaccines. That never existed. The issue had always been the individual farmers' interests to be allowed to procure for themselves, not an issue of refusal to distribute. The same farmers that now are signing an agreement with them are part of the allocation by National. From day one, MEC decided to give priority to organized formations of the same farmers. And it was not provincial departments who were administering. It was their organizations. Now, as it is said, it appears like there was a government in South Africa, I don't know which government was that refused vaccination access to private farmers, yet it's not the case. The case, it's individuals who wanted to have access themselves to buy, not because they were not allocated. From day one, allocation in South Africa was going to everyone who was exposed and on the basis of the exposure. Now, a problem is that if you listen to TV today, you will think that there was a government that was refusing distribution of vaccines to a certain group of farmers, yet it's not the case. It's the access to buy that they've been fighting off, which the minister has resolved in any case. So I think that there must be a balanced communication, especially from national department. Nobody was ever refused access to the vaccine. All of them. Unfortunately, in Northwest, the worst performers on reporting back is the same farmers. We are able to account for the administration we have as a province, communal, and everybody. It takes time for us to get report back from the private commodity organizations. They are the worst ones on reporting back, yet they are made to be the best ones. Lastly, what I would refuse is to be termed an MEC of communal farmers. Because this is where it's going. It's so provoking that it's going to a level hard to go and vaccinate your communal people. Leave our best private people alone. DG, we are MECs of agriculture, not MECs of communal farmers. That must be clarified. Thank you very much, Chair.
Thank you so much, MEC, for tabling that presentation before the Portfolio Committee. We are now going to move to Gauteng to table their presentation. Then after that, we are then going to engage with both presentations. Over to you, MEC. Honorable Trolip, I'm just quickly going out. You can just stand on my behalf.
MEC, you can go ahead when you're ready.
Good afternoon, honourable members, and to the chair and the portfolio committee and other MECs present here today. Let me make it full screen. The name is Vuyiswa Ramokgopa, MEC for Agriculture in Gauteng. Let me perhaps begin, of course, just by context setting. Gauteng, unlike my colleague from the Northwest, does not have as large a population of cattle. However, as you would be aware, Gauteng is highly affected by the trade and the movement of cattle into the province for purposes of being sold and actually accessing the market. So one of the features also of Gauteng is we are home to the biggest feedlot in the country, and thus that is a key driver of the cattle industry in the province. We also are home to a number of livestock auctions, which is a key driver of cattle being brought into the province, and therefore we are impacted by our neighboring provinces quite significantly. As you'll know, we are bordered by a number of other provinces. So in our case, there are 15 livestock auctions that are operating weekly, and as such, the volume in and out of the province, but mostly in, is something that really affects us. The current FMD outbreak would have broken out in April 2025, and as it stands today, we sit at a total reported outbreaks of 307 since the recent outbreak. That is broken down as follows: 110 quarantined farms and feedlots, and then there are also other, we've got communal farms, we've got a number of other different types of farms, and the total population that's been affected is 320,000 cattle that have been infected. In terms of the total population, it's not on the screen, but we have an estimated total population of 475,000 cattle. So of that, you will then see that we've had an infection rate of 320,000 since the period, of which a large majority of those 200,000 would have come from feedlots. Some are also some pigs, but that is far less to a far lesser amount. The geographic spread is largely concentrated in the Lesedi and Midvaal area, which is the southeastern corridor of Gauteng. But of course, we have seen outbreaks in other areas, the Germiston State Vet area, including Ekurhuleni, City of Joburg, Emfuleni, as well as the Randfontein area, Mogale City, Mrafong, etc., as well as City of Tshwane. As stated, we've had a total of 307 foot and mouth disease outbreaks reported across the province, and the majority of those outbreaks occurred on commercial beef farms. 92 outbreaks were reported in communal farms and peri-urban areas. Now, coming to our approach, when at the beginning of 2026, so let me take it a step back. One of the key issues that affected us significantly towards the end of 2025 was the availability of vaccines, as was the case in many other provinces. And we then took a decision that we needed to, of course, look at other pillars and other avenues for being able to mitigate the spread of FMD. So we developed the 4-pillar FMD rapid response approach, which we then were able to take to our EXCO, because it recognizes the need to be able to cooperate with other departments, but also an intergovernmental relations approach. The 4 pillars of the approach speak to vaccination as one of the tools, enforcement, containment, and of course communication as a key pillar. From an enforcement perspective, we are constantly hosting and jointly hosting enforcement operations with SAPS, GDAD, and law enforcement. We have focused our interventions on the illegal movement of animals, checking movement, permit compliance, and regulation of livestock auctions. Further to that, we've also collaborated with the SAPS Stock Theft Unit and conduct periodic roadblocks, particularly targeted around the auction sites. And this is important to note. I've attended some of these roadblocks. The auction sites are, of course, the high traffic areas where you are likely to then find people who are not complying, or find people who potentially are also engaged in criminal activity. So that is where we have focused our attention, and you'll see a list of some of those operations that have been done. In terms of the vaccination status, as I said, we have an estimated population of 475,000. Since the onset of the vaccine, we have administered 807,411 vaccine doses that have been administered. And the number of FMD vaccines is 520,000. Now, don't be alarmed. It's not to say we've, I heard you quoting your statistics, MEC. We have not vaccinated more animals than we have. As I mentioned in the beginning, so we've far surpassed your statistic. No, but as mentioned earlier, a key driver and a key part of our sector is the feedlots. So what tends to happen, of course, is we will then vaccinate animals in feedlots, but they would then be targeted for slaughter. So once new animals then come into the province, then there's vaccination that then happens to the new stock that comes into the feedlot. So it does seem as though we've vaccinated more, but it is not the case. We have also started the booster vaccination program, so that would also influence those numbers. But from a percentage perspective, we are currently looking at a 64% herd immunity to date. That's just a visual representation. As mentioned, we also, this is just a breakdown in terms of the different commodities. Yeah, let me move from here. So we've got a number of different vaccines that are currently in circulation. The Biogenesis Bargo Dolvet vaccine, as well as the ARC vaccine to a lesser extent. We had initially placed orders with BVI. BVI was not able to deliver to us. So that was actually quite unfortunate, because we waited a good 4 months, 4 or 5 months actually, before being told that they were not going to deliver. But we were then obviously through the National Department able to then access the additional vaccines. In terms of the human capacity, so from private vets, obviously there was an introduction of private veterinarians. 63 private vets applied, and they are broken down into different regions. And we've also received applications from commercial farmers and small feedlots. And the total doses issued through these channels is 194,000. I'll come to some of the challenges there, but certainly one of the issues that we had initially was also delayed reporting, coming from the private veterinarians specifically. But I believe we've now done some work to get them to actually report timeously, because that affects our ability to track the rollout and the vaccination rollout. The other pillar being containment and surveillance. This is a very critical part. So containment, of course, in communal areas and peri-urban areas remains a challenge. And the lack of handling facilities becomes a challenge. So the department has also procured additional mobile handling facilities, but the impact was also that it slows down the rollout of the vaccination process. One, traveling to different locations, but also the process of actually vaccinating through these mobile handling facilities in some of the communal areas does impact the speed at which we are then able to roll out the vaccination campaigns. Controlled slaughter is another element, and since the onset of the outbreak, 5,984 permits have been issued for controlled slaughter, and 255,325 cattle have gone through this controlled slaughter. And then, as now we are looking to actually lift some of those quarantines, because we have some farms that are under quarantine, we are likely to see that this figure will not be increasing too significantly. We also see before us just a representation of the numbers, the controlled slaughter numbers, and that is per month. With regards to the vaccination program, I've touched on that already. There was some discussion I hear about the ear tags. The procurement process took longer than expected through the tender systems. So we have relied on the National Department of Agriculture to provide the ear tags to provinces. But that process is also still awaiting finalization. So it is going through a process, but it is a challenge to be able to have access to ear tags. Where we have conducted vaccination operations, we have been using the stock available, but we would obviously need to expedite that process. Communication is also a very key part of our response, and we have, as part of our communication, hosted a number of stakeholder engagement sessions in the different regions, convening different farming communities. We have invested quite significantly in radio as well as online channels through social media, through our WhatsApp dedicated FMD channel, as well as the online portal that has been developed, which is linked to the GPG website. Broadcast media is obviously a very critical channel where we have been communicating on all of the key community radio stations and national radio stations, and have also engaged some television communication channels. And the key thing there is about driving awareness, sharing information, but also updating timely updates as they come. This is just an update in terms of where some of the engagements, stakeholder engagements, have happened. Magaliesburg, Midvaal, Tarleton, and we continue. They're always happening, so they're on a continuous basis. We also had a joint operation with the previous minister. Equally, it was focused on engaging communal farmers. So, as stated earlier, one of the key challenges that we faced at the beginning of the outbreak was the availability of vaccines. Another key issue, but we've kind of since been able to at least address that as vaccines have become available. Another key challenge has been capacity, and particularly the personnel available to be able to scale up our response. We did receive an additional allocation from Treasury of 63 million rand to support our ongoing foot and mouth disease efforts. And that was split across a number of different categories: FMD vaccines, mobile handling facilities, consumables, ear tags, and additional human resources in the form of animal health technicians, pharmacy assistant, and 4 state vets who have been brought in on a contractual basis. Infrastructure for vaccine storage and handling. So the GDOD vaccines were stored at the Honest-to-Port facility. So that is what we have been using so far. And in terms of some of the challenges, as I outlined our approach, one of the challenges that we have brought to the attention of MINMEC repeatedly is the issue of movement control and the inability to enforce movement control protocols due to the nature of the legislation. We were looking forward to the Section 9 amendments, but we have not, we've been able to get people to comply by supplying the necessary declarations. But the real challenge that we face is an inability to really enforce movement control, both in and around the province, but also in and out of the province. And that also speaks to IGR broadly. We have got quite good IGR platforms. We have a joint operations committee wherein we have representatives from SAPS and the different municipalities and the provincial GDOD represented in those forums. But of course, bylaw enforcement and just general law enforcement in our communities becomes a challenge. The lack of state-owned animal pounds and the fencing of communal grazing areas is also a challenge. If and when we find those who are in contravention, it becomes impossible to enforce any of the measures because of the lack of state pounds, and so that becomes a challenge. Let me see. I think we are close to the end now. Yeah. So, and I think that really concludes the presentation. But suffice to say, we continue with the approach. I think vaccination has been certainly very helpful for us. But I made this point even in our previous meeting that we really do need to strengthen our ability, both in terms of interprovincial coordination, but also in terms of our intergovernmental coordination to strengthen our approach. And, without strengthening our ability to control the movement of animals, I really think we are kind of, as I say, filling a leaking bucket. We can vaccinate, but in our case, it doesn't really help us if we are constantly facing the onslaught of new cattle and new cattle populations then coming into the province. So that's something that is a focus area for us. And of course, capacity is something that we continue to want to strengthen, to make sure that we have the necessary capacity to reach all the different areas that need to be reached. Chair, thank you very much.
Thank you very much. MEC, I'll hand over back to the chairperson.
I'm now going to note hands from honorable members who would want to engage with both presentations. I see Honorable Ndalane, I see Honorable Mtetwa is going to be followed by Honorable Van der Wart, and then, what is wrong? Am I pronouncing his name? Van der Wart. Walt. And then Honorable Trollip is going to be the last person to ask questions. In that sequence, honorable members.
And good afternoon. Northwest, how many confirmed FMB outbreak are there currently in the Northwest? And in which district or municipality? What is driving rapid spread in communal areas near Botswana border? And then why is Northwest lagging behind other provinces in vaccination numbers despite the risk? Gauteng, what is the roadmap to regaining FMD free status for export market? What support will be given to farmers affected by export bans? Thank you.
Thank you, Chair, and greetings to MECs and officials, and greetings to our fellow honorable members. There's a silent issue I would like to pick up on these two provinces because the reference is in another province. There is a farmer called Mr. BP Greiling in Vakestrom. He's practicing something that is going to be a cause or effect of FMD spreading, the farm eviction in this season. He dug the graves of the community that is residing in Vakestrom, and then it forces the entire community that reside there to obviously leave, flee the farm with their livestock and everything. Now, but the point I'm driving is that how farm eviction is automatically spreading the FMD across, because we don't know where these people are going to go to. Wherever they're going to go, they will be unnoticed, unrecorded, they will disappear because now they've lost their place of abode. But I'm raising this for other provinces because we see a lot of commercial farmers evicting our people. Now, how does farm eviction, how can we curb it that during this moratorium of emergency status of FMD, that we also regard farm eviction as a contributor or an enabler in the spread, because you are causing an action-reaction for people and animals to move anywhere uncontrolled. Why? Because you have a desire to chase people out of a farm. And that is across all provinces. And then moving forward to Gauteng. It's interesting, Gauteng, because you are at the center, so you are actually a recipient of all livestock coming from almost all provinces, if possible. Now, which means your controls in terms of entry at the borders of entry across need to be very tight. But I'm interested, what are the trends from provinces that are inletting livestock into your province? Who are contributors the highest or bigger in terms of numbers of infection? Because then it will say something about that province in terms of vaccination program. Because the same thing we do on a border at an international level like Lesotho and Free State, KZN, we need to be doing a border management such that whatever vaccination that takes place in that province, make sure that at the point of entry that there's also vaccination so that to lessen the amount of infection that happens at a cross-border level. And Gauteng, you are almost a doorway to all these provinces. And so it will be interesting to hear how you're managing that. But also, Gauteng, you are land short, so you don't have much land. It would be interesting to know, how do you then manage your quarantine protocols? How do you deal with the issue of communal farming in terms of them complying? And seeing that this one is interesting for me, do you then have an activity in Gauteng that also may contribute to an exit? Like if anything exits from Gauteng, it could be slaughtered cattle or feedlotting that moves, since you are the biggest in feedlotting. So it emanating from Gauteng into these provinces to check the cross spread done by Gauteng by virtue of you being the biggest feedlotting province. Other than that, let me leave it there. This one, the Animal Health Act and the Animal Disease Act. Foot and mouth disease is not a new disease. So even if we are using, I see this legislation, animal disease is 1984, but the disease is old. So how unconstitutional is the existing legislative arrangement in relation to the disease itself?
What are the aspects so that we tweak those and make intervention legislatively to tighten if there is an area, a grey area in law? Thank you.
Chair, yeah, I know Gauteng, I think you started a bit slow in the beginning because we had several. I'm from Limpopo, obviously, so we know. Maybe if you can just explain what was the reason for that, especially with your biosecurity movement. I'm not sure about your vax, if you did start that quickly. Your vaccinations. But my questions are to Northwest, and so you actually opened yourself to a string of questions that I'll submit in writing, which I have to answer, otherwise our speaker will be on to you. But here's the first thing. What have you been doing since the beginning, and I follow your committee, by the way, your movement and your biosecurity. You were far behind in the beginning. And I think you should explain to this committee why, and what are you doing now? We patrol the streets in Limpopo, and I can give you a string of photos of Northwest trailers and trucks coming through, sometimes from Rustenburg to Abazimbi, other times, and mostly at night. Do you have anything in place to prevent people from crossing your province's borders to other provinces to make sure that the Ds, and I'm not quite sure, but I have, and I'm trying to check with the farmers relevant or the state vet, is that I think one of the first cases in Modimolle actually came in from Northwest. And then maybe you can also give us a breakdown of all the FMD vaccine shipments that was distributed through OBP to your province. And my other question would be, can you also, for each supplier, the number of doses that you received from Dalvet, Biogenesis, and ARC? And like I ask all the other provinces as well, your primary vax compared to your secondary, your booster shots, where are you on that? For now, that's it. The rest I will send in writing. Thank you, Chair.
Honourable Trolip.
Thank you very much, Chair. Just to the MEC of Gauteng, she said that they regularly conduct periodic roadblocks around auction sites where there are high traffic, which are high traffic areas of animal movement. Could the MEC tell us what they find there with regards to compliance to the Animal Identification Act? Because, you know, we sit in these committees and talk about ear tags and radio frequency and tontons as if we don't have. Oh, do you want me to tell you what that is? I see our secretary or our researcher is pulling a face. Radio frequency identification tags. As if we do not have an Animal Identification Act about branding and tattooing of livestock. Ear tags are temporary. Thieves cut animals' ears off. Thieves cut ear tags out. You can't really cut a brand out of a living animal. You can, you know, once it's dead, you can get rid of the skin. But tattoos, equally, you can't eradicate them. So I don't know why we don't speak more about existing legislation around animal identification and what happens at those roadblocks when people are moving livestock without adherence to the Animal Identification Act. Then with the MEC said that they've reached 64% herd immunity. I take it to mean vaccination, because we won't reach herd immunity yet. And then also I didn't hear the MEC talking about LITs. How far has there been any progress other than perhaps pilot or training for LITs? Because this is a problem that we picked up throughout today's presentation. Thanks, Chair. And then my last question is to the MEC of the Northwest, and I apologize to you and him that I arrived at the tail end of his presentation. I'd had set up a meeting between 1 and 2 that was delayed, and hence my delay in coming back. I did hear the tail end of the presentation. It was passionate and somewhat theatrical in its conclusion, where the Minister or the MEC said the MEC is not going to be the MEC of communal farmers, and not leave the best, quote, best private sector farmers alone and let them carry on because they are the worst at reporting back. Now, that's quite a sweeping statement, and if they are the worst, the stakeholders, we know who they are. I mean, the Minister himself told us exactly who the stakeholders are. They're red meat producer organisers, MPOs, farmers' unions, etc. Have these concerns that the MEC concluded with been reported at the ICC and the ministerial task team? If there have been, what has been the feedback? If there haven't been, why haven't they been? Thank you.
Yeah, maybe just one question on my side, MECs, on the slide that is speaking about the private veterinary participation in the FMD vaccination program. There is somewhere there, the last bullet, that speaks about total wastage due to breakage and spillage between both public officials as well as private veterinarians is 699 doses. What are the mitigation measures that are going to put in place to try and circumvent this risk that you have identified? Are there any measures that you are thinking about, or anything that the national department is going to assist with, or some interventions that maybe DG might also think about in trying to mitigate this risk? And the second part is I can't pick it up from the presentation, but I heard when you're speaking that also with regards to private participation, there is a level of delayed reporting from our private vets. What may be some of the factors that are causing this delay, and what is it then that you are going to do to ensure that they do comply with some regulations and legislations therefore? Thank you. DJ, are you going to start, or let's then give them an opportunity to speak? We can start with Northwest, then Northwest is going to be followed by Gauteng.
Thank you very much, Honorable Chair. I would request Dr. Magibi, on the basis of some of them being related to the practice, especially the issue of confirmed cases and the issue of movement and biosecurity measures, vaccine shipment, you would deal with those ones. You can deal, okay, it's not in the province. Let me speak, you will add even if I've spoken before you, but in the province you speak before me. Okay, thank you, Chair. Now, the issue that is driving the high number of exposure in the border, Botswana and South Africa, it's because of inadequate and in some instances absence of border fencing as the reason. And it's the movement matter. And you would also understand that unlike us, in Botswana, if a South African cattle would have roamed until Botswana's side and found to be having FMD, it is killed in Botswana. Unlike in South Africa, even theirs, in actual fact, any exposure detected and confirmed, they shoot at them and then deal with matters of compensation. But that element is the issue of movement between South Africa and Botswana. and in this instance, affecting both of us largely who had started vaccination before Botswana. In this instance, that's why the 7th of April vaccination was targeting the borderline, and the one we want to repeat, we want to do the same. So that question of SADC or bordering countries that have not yet started vaccination, we started before Botswana, and even the first cases were ourselves before them. That's why we had then dealt with border vaccination so that they don't have a claim that their transmission is as a result of South African cattle crossing to their side. That's the one. Why is Northwest lagging behind other provinces? No, we're not lagging behind on actual cattle vaccinated. We might have been amongst the West when it started, you are correct. That's true. We picked up very late. But on actual cattle vaccinated, we are not behind. We would be in the top 3, top 4 on actual as we are closing for the primary, and to go back like a question. We have still not yet started with boosting. This is the primary, that 1 million, it's primary. We still have to go back on the one above boosting. The next one on farm evictions, and this is where DALRAD, in fact, land reform is critical, because land tenure is their responsibility, and evictions in farms are managed by themselves, but quite correct. It also has an element of disrupting management control, because the time a person is evicted with everything he owns in the area that it must move out, there's nobody to give out a notice, because normally an eviction does not have a notice before. This is where only when reported by the evicted community members, then you can activate land reform to then deal with the issue of land tenure in that regard. So that movement is also affecting the spread, because it's not controlled and not pre-noticed. It's just eviction that occurs. You only get informed by the ones who are evicted and not the one who's evicting in the process. That's what we have on that one. Quarantine protocols, communal areas, that's true. We've been struggling to manage quarantine protocols in communal areas because everything is shared. So they will share grazing, they will share drinking area, water access areas. And that's why when we were responding first, we did an assessment and then requested land reform to then find ways to help the province have a dedicated budgetary response to split these areas. That's why they then approved 54 million on their side to give us to control this matter. Now, on the last one, Chair, before Dr. Makibi, now the issue of reporting, it's not theatric, it's real. It's just that Gauteng might have used a better language than me. And in actual fact, it's expected in any case, because Gauteng is a metropolitan province. I'm from a rural province. So language-wise, we may not have similar language. Gauteng says private vets, they have a problem on delaying reporting. No, I did not say delay. I said they are the worst ones on reporting, and I mean it. And this has always been a matter that we attend to provincial statistics. Each time we combine our statistics, we check who was allocated what, where is the report. We don't then run to the minister and they please do something to them. We engage them because the allocation is done through us as a province. We expect them to report back. It's a fact that they are the ones who have not been the best on reporting on time. Gauteng, it's correct. I can still withdraw my theatric and be covered by the best English analogy ever from Gauteng. delayed reporting. So I'll still accept that, but it's a fact. It's not like I'm saying they must not be allocated. They're allocated, but it's critical that when you are allocated at the time of reporting, you must have reported back, but it's not the case. So Dr. Majibi, can you deal with others? Thank you.
Thank you, MEC. Thank you, Chair, and good afternoon to all honorable members. I will respond first to the numbers. The outbreak cases in the Northwest, just a week before, were 476. The latest contingency plan has provided for closing of cases, and a good number of cases are actually being closed off now. So we may have reported a bigger number just a week before. Just this week alone, the number has reduced. We have closed up to 103 cases. So the number as it is, it stands at 387, and this number is continuing to decrease as more and more cases are being closed. With regards to the drive of the spread towards Botswana, MEC has covered that very, very accurately. But one of the actions that we are undertaking, there was a meeting recently that was held between provinces that have borders with foreign countries, and there was a decision that was taken there. On the South African side of things is that we're going to strengthen vaccinating in those villages that border that are at the borders. If honorable members will notice, that was one of our primary strategies that we use. We were targeted to vaccinate border-lying villages right from the beginning. The eviction question, MEC has addressed it, but what the intervention that agriculture, veterinary services can do in there is also to ensure that animals that move to whatever destination would be safe and off. So the intervention that we would normally do is to make sure those animals are vaccinated, they're inspected, just to ensure that at the destination they do not become a danger. The question about the Animal Health Act versus Animal Disease Act, the primary difference there is relocation of authority, and the act itself is in the process of being the regulations of the Animal Health Act in the process of being finalized. But currently we have a situation where the authority of implementation of veterinary services lies centrally. And we've been operating like that in South Africa for since historically. And when it finally gets, the regulations finally gets approved, then there's going to be that shift. And we are currently in the process of familiarizing ourselves with the new status, the operations of the Animal Health Act. It hasn't come to effect yet. Then there was a question from Honorable van der Walt regarding the slow start. I think MEC has addressed that. I just want to add that technically we were very present on the ground. The area where we lagged in was in as far as, because there was an online reporting that was introduced, which we didn't catch up as soon as we should have. Then we caught up. Then we, if any of the honorable members go in there now, they will probably notice we are pretty much on par, and lately in the past few weeks we've actually been surpassing what has been reported on the portal. The portal itself, honorable members will notice, has got aspects of it that are not necessarily in provincial control anymore, like it's not only provincial officials who report into a portal. There's other stakeholders that report on it. So that has to be taken into cognizance also when we look at things. The breakdown of vaccines allocated. There's a slide that was shown in there. OVI, ARC vaccine, we only got 1,400 doses, which right at the beginning in February, which we used only on a dairy farm. All of it was used up in that dairy farm. And there's a breakdown that MEC presented with regards to bioaftogen according to batch numbers and dates of arrival. The one that totaled 1,270,140. The breakdown, I just will not going to go into the different breakdown of different batches and vaccine types, but it's there. We can avail it. It's slide number 11 on the presentation. MEC has addressed this question of delay. It is a fact that we are living with, we are realizing even as we operate. There are private vets that have been authorized by provincial authorities, and their allocation comes from allocation that was primarily given to the province. So necessarily, their reporting has to come through us. That's where we experience the least delay. We have not to report, but we've discussed it in our stakeholder meetings with industry stakeholders, and there is a VNet organization that has undertaken to play their role in bringing these reports back. It's not the only way we'll do it, but that's for starters how we're handling it. The wastage. Just to mention also, these stakeholders that we sit in the province with are partly members of the ICC, and these issues have been handled. The issues of these delays have been handled at MinTech Veterinary Working Group. So it's an issue that's common amongst many provinces as well. With regards to wastage, it's 2% of the allocation that we have received. Yes. The wastage keeps changing on a weekly basis. Of the 1.2 million vaccines that we've received, 22, the week when the report the MEC was presenting was compiled, we had 22,000. It has slightly increased this week. But this is, we prefer to call it discards, actually, not really wastage or spillage, not really spillages, because the prescription by manufacturers, they've got a specific prescriptions that you can only use an open bottle for a specific time after you opened it, and beyond which time you're not supposed to use it. In our MinTech Veterinary Working Group, we've discussed this as well. There's an element now of maintenance of cold storage, which extends the life cycle of an open bottle. So you can use it beyond just the 8 hours that was prescribed. Also, in instances where it is possible, we use these half-open bottles on smaller herds. And that's possible in some instances. In some instances, it's not possible. Then it's going to be recorded as discarded medicines, basically. Chairperson, thank you. And in a nutshell, that would be. Thank you very much.
MEC Ramogopa.
Thank you once again, Chair. And if I may also, I'll address some of the questions, but also request that we permit the Chief Director for Veterinary Services, Dr. Rabulau, to also augment on some of the responses. Let me begin without wanting to put myself at odds with some of my colleagues, Honourable Member, but refer to the first outbreak that we had in April 2025, which actually emanated from KwaZulu-Natal. So that was the source, actually, of the outbreak in Gauteng. Following that, though, as you've correctly stated, because we are bordered by a number of provinces, we certainly also then see the movement. My honourable colleague here to my left, you will know, just northwestern Gauteng, you drive down one street and you are in different provinces. So one of the challenges, and hence why I highlighted, our 4-pillar approach speaks to enforcement. We have weak or non-existent provincial borders in some instances. And it is near impossible to try and enforce, even though the regulations may exist, even though we may put out a certain communication limiting or requesting for the limiting of movement of animals, it is near impossible to enforce. Secondly, it requires, of course, resource mobilization and assistance also from the SAPs and other law enforcement arms. So that also becomes a challenge. And what we've tried to do with SAPs is then to say, how can we also jump into some of their already planned law enforcement operations, where we can then deploy some of our agricultural GDAD representatives to go and join some of those operations. And then, as Honourable Trollop touched, then we also do some of our own at the auction sites. So to answer your question, the influx from different provinces really comes from all of our border provinces. KZN was a primary area. Northwest, there is a lot of movement of livestock also, but Limpopo as well is an area that we experience an influx from. And Dr. Rabulau can maybe talk to that in more detail. I can't actually, I'll also ask him to speak to the exit, because I must say I don't have those statistics on site. But suffice to say, and I think the Honourable MEC from Northwest made the point earlier, that a cow will come in, a 2,000 Rand cow comes into Gauteng, and by the time it gets to Gauteng, it's 7,000 Rand, right? The same does not apply in the opposite direction. So indeed, there is a lesser prevalence of livestock moving out of the province than into the province. What you see from the province is would be maybe perhaps exported products, but also the produce, let me say, movement between the feedlots, because feedlots have sites at different locations. However, the feedlots themselves actually practice quite relatively high biosecurity measures. So they are not necessarily, the movement between their different sites is not necessarily a key driver. We visited some of the major feedlots. They do practice quite stringent biosecurity measures, even when they are moving from Gauteng to some of their out-of-province sites. So I think that's something we can also give a bit more detail on. Honourable van der Walt, I think it is. I wouldn't say that Gauteng started late. As I said, we had our first outbreak in April 2025. And the biggest thing that affected our ability and our response was the availability of vaccines. That was the crux of it. Once we had vaccines available to us, we hit the ground running. And quite frankly, even before the additional vaccines from Biogenesis and Dolvet were available, we actually took steps to try and procure independently from Botswana, from BVI. We placed orders with Botswana at a time, we actually kind of, I don't want to say deviated, but we took some initiative to then place some direct orders with BVI, which unfortunately ended up not in our favor because they ended up not delivering. And the other vaccines that came from Dolvet and Biogenesis actually ended up coming before. So the availability of vaccines really was a key factor for us. And the inability to then implement stringent movement control restrictions made it virtually impossible to then really address the FMD outbreak. You'll recall, many of us will recall, even during the COVID period, one of the key mechanisms to controlling spread of COVID was lockdown. But we have faced resistance from the industry who do not want to see their livelihoods being disrupted, understandably. Their ability to move livestock, to trade livestock, gets impacted when you put a hard lockdown. And that has been the pushback that we've received. So it's a chicken and it's a catch-22. Do you lock down the industry and potentially cause economic harm, but for long-term benefit of being able to curb the outbreak? And I think that's a challenge that we're going to continuously navigate for reasons my other colleagues have also expressed. The question around the roadmap to regaining FMD-free status, I also believe the National Department is really the ones to speak on this, because the plan that would have been put forward by the former Minister Steenhuisen spoke to a 10-year roadmap towards FMD-free status, of which the first step was the aggressive implementation of the vaccination program. And Honourable Trollip, you're correct. The target that was set for this year was to reach an 80% vaccination rate. So of our provincial herd, the intention was to reach 80%. You're correct, we are now at 64%. The idea was that by the time we get to 80% of the provincial herd, we are as good as having herd immunity, because at that point, you've really touched most, if not all, farms. So we are at 64% currently. Our objective is to reach 80%. We are effectively on track. All things remaining equal, we are on track still for our end-year target. But that plan, Honourable Member, is then a 10-year plan. Now, I think that's something that we must collectively engage with on an ongoing basis, whether our approach will indeed yield us that outcome. Because 10 years is a long time. Many of us may not even be here 10 years from now. But I'm hoping that I would imagine that the industry would want to see a swifter resolution to this issue than 10 years. So I think it's something that we need to put on our collective agenda to see what we could do or how we can strengthen our response to bring that timeline forward, possibly. Certainly from what one hears from the industry, it's a hard pill to swallow that this is going to be with us for the next 10 years. And then, sorry, I'm just trying to see my notes. Honourable Trollip, on the roadblocks. So it's a mixed bag. Some of the things we look for in the enforcement operations is indeed brand marks and paperwork, proof of ownership, as well as the animal health declarations that people would have had to fulfill, confirming, of course, that their animals are not infected, or not having any issues, or declaring what issues they may have. And it is a mixed bag. Certainly, I haven't been to all of them, but even in the operations that I have attended, there are people who will arrive with, yes, brand marked animals, but paperwork not fully or properly fulfilled, or maybe no paperwork. And in some cases, of course, where there are questions around ownership or an inability wholesale to prove ownership, that's where the law enforcement element kicks in. I spoke to the challenge that we have of the lack of municipal pounds. That's also part of the issue. So when you do find these contraventions, you can't really confiscate the animals and take them anywhere. So that becomes a bit of a, let me say, an enforcement challenge. You can give people a notice, you can give them, and I think Dr. Rabalau can speak more to this because he's been in more of these operations, but that does become a challenge from an enforcement perspective. What then to do with these cattle? And then the other thing, and I think the other element which you didn't specifically ask about, but it was something that, of course, we addressed a couple months ago was the issue of F branding, and the fact that, you know, people actually there was resistance to vaccination initially because of the F branding. And the requirement for that. So that's why, so then that was then taken away. But the point is that there was even that element of discrimination in the market. Animals that then are F branded would be fetching a lower price in the market, or people felt like, you know, they were seen to be infected or below par. And so there was then a resistance also for people to declare when they found FMD outbreaks on their farms or to volunteer for vaccination. That seemingly has at least subsided for now, because that requirement has been taken away. Chairperson, on the issue of breakages and losses, I will say that it is a challenge. But certainly from our side, it's one that we have largely been able to minimize. You know, the 600 and something case instances of breakages relative to the 520,000 doses that we've given is a percentage of 0.13%. So I'd say broadly, it's not out of control. It's certainly not an issue that we feel we don't have, you know, an approach to. But of course, we would rather have zero. You know, I think any breakages or any losses are not welcome. And I think Dr. Rabelau can perhaps also then give us his plan on how they plan to get to zero. But certainly from our side, we are quite. We've been quite, you know, militant about making sure that we minimize losses, and as such have been able to keep it to a relatively low amount. And then in terms of also, Doc, you can deal with the question of the vets and the measures we've put in place, but we have, once we picked up on the fact that we were getting delayed reports from the private veterinarians. And that was affecting our ability to report on our rollout. We actually then did put some compliance measures in place. And we have put a time limit. I think it's 1 week, Doc? Yes. So we've now put a weekly reporting requirement that has been communicated to the private veterinarians. We've seen an uptick in the rate of reporting, but indeed it does present a challenge when the lack of compliance is coming from all of these other different sources. It's difficult to manage and to report accurately. Let me pause there, honourable members, and hand to Dr. Rabelau to then address some of the outstanding matters. Thank you. Thank you, Chair.
Thank you, Chair, honourable members and MEC, HOD. I think some of the questions were really also covered by my colleague, because I'll give you an example, the issue of wastages, you know, because if you have to immunize a small herd, I think from a scientific point of view, we have to ensure that we use the vaccines according to the manufacturer's guidelines, so that should there be any litigation, you are at least within the framework of having complied with what is required. So if, for instance, a bottle says you can vaccinate 100 animals and you come across a farmer that only has 20, so obviously the other 60 doses would be wasted. However, as Dr. Majibi said, because there is a veterinary work group meeting where all provincial directors interact every week. We are trying to find best possible solutions to the problem, including engaging the manufacturers of the respective vaccines. And I think the issue of the roadmap, MEC covered it adequately, except to add by saying the 5 to 10 years was not a thumbsuck. It was based on sort of engagements and benchmarking internationally with other countries like Brazil, in terms of what challenges they had and how long it took them to be able to bring the situation under control. So it's not something that's going to happen overnight. And again, we are not a federal state. We are a United States country. So we are dependent on each other as provinces. It cannot only be a Gauteng or Northwest approach in terms of getting the situation under control. If our neighboring countries are weak in terms of support, whether it be from vaccine, capacity, transport, it has a tendency to then have a negative impact on the neighboring countries. Hence, we consistently emphasize an integrated approach in terms of us stabilizing the situation. Then there was a question around the support to affected farmers. Of course, the support that we have been given is that, and I think I would also link that to the issue of Gauteng having started slow over and above what MEC has said. We did not just vaccinate out of, without direction. We had to prioritize certain, within a risk-based approach. Like farms that had clean buffalo and probably had cattle farms around them, we had to say we have to create a buffer or a wall for the virus not to get into the clean buffaloes. And then the second category, of course, was our dairy cattle. Given the fact that, the disease manifestation in dairy cattle, it's quite severe, and it also has implications from a welfare aspect. I mean, for those of you who have seen a dairy cow with FMD, it's not something pleasant to have a look at. And then, of course, the third category was our communal farmers, which I think the challenges cuts across all provinces in terms of handling facilities, in terms of the difficulties to be able to put those particular heads under quarantine. So that is the type of support that we've been given. And if a farmer would report an outbreak while the vaccine was not enough for all of us initially, that's how I think across the country we applied ourselves. We were chasing behind the disease because we had to make sure that whatever resources that we have, were prudently deployed and where it was necessary. Had we had the vaccine, I think we could have done significantly well in terms of speed. And I think the last slide from Gauteng that MEC projected in terms of the AP curve, you can see that we are, the number of reported outbreaks have significantly gone down. So we think our interventions are working, but once again, it's dependent on, we are as strong as Gauteng as the Free State and the Northwest are, because this is where the market is. And I also want to link it in terms of animals exiting Gauteng, because one of the biggest fleet lots, of course, is in Gauteng, but we were referring to controlled slaughter. So those animals would move under a Red Cross permit. We will put a seal, and that seal will be broken at the point of destination to ensure that whatever consignment that left Gauteng reached the planned destination. So hence we refer to, controlled slaughter. And yes, given our porous borders, we had a workshop, I think it was on the 18th of March, because the appetite from the law enforcement agencies was quite low. We had to indicate, take them through how FMD. We had subs, we had law enforcement agencies from all the metros, from all the districts, where we took them through how the disease looked like, what sort of documentation is required, and then shared the contact details so that should they come across a consignment, we will be able to be called upon to come and check. And I think the issue of pounds cuts across all provinces. Most consignments that we found not to be compliant, we would then send them back to the point of origin. However, the risk is you are not sure if they will really go there because they are not moving under an escort. And then in terms of support to farmers, I think one honourable member asked. I think our national department is also heavily engaged with our international trading partners to at least generate an appetite for them to accept products that come from vaccinated animals like meat, because they are not really, how can I put it, it's not unsafe for a human to consume it, but you cannot impose yourself on your trading partner. So there are several countries that have already indicated their willingness to engage by accepting vaccinated animals. But once again, it links to our ability to be able to have a, how can I put it, credible traceability system, because you have to be sure that that particular animal was properly vaccinated. And I think further to that, I think the protocols have been revised. Previously, it would take a farmer about 6 to 12 months for us to leave quarantine. Now it has been reduced to about between 16 and 42 days. So the financial losses, at least in terms of the farmer being able to trade with that particular animal, you know, have been sort of reduced. Yeah, LITS was piloted in Limpopo as per the previous discussion. However, I don't have to repeat the reasons that the various provinces have mentioned. In Gauteng, we've been losing an ArcGIS system where as you vaccinate, you ear tag the animal, you are able to use your phone and, you know, it would fit into the system, you know, where the vaccination actually took place. Because I think identification is very critical, and that is the strict protocol that we are supposed to follow. Unfortunately, it's not happening in every province, and hence also perhaps some of the figures might look a bit low, because to ear tag and to restrain that animal is quite a labor-intensive exercise. However, yeah, together with our National Department of Agriculture, we are trying our level best to come up with a credible system. And then in terms of the booster shots, again, priority, we have started in Gauteng, but priority has been given to the dairy, given the fact that they stay longer on the farm and the severity of the disease in dairy cattle, it's more severe. You know, the feedlots, after a certain period, they have to be sent to an abattoir. So we have started with that. And I think MEC have spoken to the roadblocks. Most of the non-compliances that we really observed were mostly documentation, because we would check, you know, is the animal properly identified? And then the main thing was the farmers did not sign the health declaration, so we would be lenient enough after having checked that everything is okay, so that should anything happen, you know, we are legally covered. We would allow the farmer to sign that health declaration. And given our limited resources, we had identified auctions, as previously indicated in the MEC presentation, as our hotspots. That is where we predominantly conduct our activities, because the market is in Gauteng. In terms of the private vets mitigation measures, they were given a formal notice to submit the reports within a specified period, failing which we would not be able to give you more vaccines unless you have accounted for the number of vaccines that we have given to you. And over and above that, we have engaged the RMIS, the Red Meat Industry Services, as the private sector to assist us. We have also had engagements with Ruvasa. They had requested a list of those vets that are not compliant, so that they could also elicit cooperation from their side. And I think the issue of the animal health and the Animal Diseases Act, Dr. Majibi covered it well. We were, given my limited legal advice, we were told that the Animal Diseases Act is unconstitutional. So it will be given to the provinces. However, I think as provinces, and I think justifiably so, we are arguing to say funds should follow function, because we don't have quarantine stations. We don't have, to set up a quarantine station, to set up many other activities or facilities that may be delegated to the province. We are going to need a budget for us to be able to do that. And of course, FMD also put a bit of a spanner in the wheel, but I think there is a huge appetite from our national department to, I don't want to say to, but it's in the pipeline in terms of that. I think I have, I've covered most of the questions. Thank you.
Do you want to raise some follow-up questions?
Yeah, please.
Okay. Maybe before we do that, DG, do you mind to, or do you want to also make some few comments? Yeah, before I allow honourable members to raise follow-up questions.
On a point of order, surely the DG should conclude. Are my follow-up questions to one of the presentations?
Do you know why I'm saying that? I could see his reaction when they were responding. Maybe there's something that you want to rectify. I'm nursing a fear that maybe you are also going to raise what the DG can also clarify.
No, thank you very much, Honorable Chair. I think one of the issues that was raised was by Honorable Trolip, and he's correct. If you have got to look at the ecosystem of our legislation, the Animal Identification Act is at the core of that. And our current use in terms of migrating towards leads is meant to remedy one thing. If you look at the Animal Identification Act, it actually ties an owner to a head, not an individual animal, because then you have got to brand the individual animals and they become a head. But if you have got to trace back on those animals, you cannot say that this is an animal ID XYZ. So that's where you have got now to bring this RFID tags in order for you to go to an individual animal that would enhance traceability. But what we are doing currently, Honorable Trelip, in terms of the current vaccinations that we are having, most of them also are tied up with an engagement with the farmers around the issue of animal identification. As late as we had an engagement in KwaMaphumulo, it was the very same thing that was done. You go through and you also ensure that that animal identification is also promoted amongst the farmers so that you can have at least that level of engagement at the head being tied to an individual is always guaranteed. There was an issue that was raised regarding the Animal Health Act versus the Animal Diseases Act. And I think Dr. Majibi has articulated that point well. However, there's a point that is missing. There have been consultations that have gone ahead to look at the regulations. And out of that process, there are a lot of comments that came from the public in and around the Act itself and the regulations, which we have got to distill as the department before going out and see what those are. But most of them point to quite a few issues that the colleagues have identified. And we will come back to Parliament in terms of what we found in terms of that process, because I think it's very important. And it's also important to note that the Animal Health Act was around 2002. It's almost a number of years, more than 20 years since the promulgation that we have got to look at and say, are we still, in this case, on par in terms of dealing with the issues that were identified 20 years ago, and whether there are other issues that have emanated during this current discourse, especially if you have got to look at the issue of FMD and how it has exposed some of the areas that we think that we have got to remedy within various legislative pieces. There was an issue around the roadmap, and maybe I need to pause here and settle to say we are dealing here with a virus and the interaction of a virus and its environment, and it will therefore be dictated to by that interaction. weather environment would mean animals, livestock, would be game, would meet people, and how it affects all the areas that we are looking at the value chain. And therefore, the strategy has got to be adaptive to what you are currently experiencing as a country. So you would have adaptive, to be adaptive in terms of your strategy within what you are practicing. For instance, if we say that we are going to vaccinate the whole head, so that the aim is for us to have FMD freedom status with vaccination and ultimately without vaccination. If you now suddenly realize that there is a movement toward wildlife in South Africa, you might have to tweak and change in terms of what you are currently experiencing. And that is why each and every time you have got to be adaptive on the issues that you have got to face. Now, if we have got to look at what the strategy is at the country level and also at SADC level and what we are doing with the bilateral arrangements with our neighbors, is that at SADC level, there was a ministerial that agreed that we are going to go for a regional approach at SADC level. So it's there, it's documented, and it's going to be pronounced, I think, even now at the summit. Now, what it means is that all countries have got to come on par and ensure that they have got all their levels in terms of measures, surveillance, vaccinations on par, so that we can deal with FMD at that particular level. And to show the commitment that South Africa has towards the regional approach, as indicated, we have got almost 150,000 doses that have been allocated to our neighbors just to deal with this particular element that we are dealing with. Those are the issues that I thought I should just emphasize, Chair. Thank you.
Thank you so much, DG, for that explanation. I'm going to note hands who would want to make follow-ups. Okay, you want to speak as well? Okay, no, let me note first. You are going to be the first one. You are not going to. Okay, come back. You are going to be the. No. Comrade Trollip, Honorable Trollip, you are going to respond. You are going to be given an opportunity to make a follow-up. But he's seated there in the corner. Honorable van der Walt is going to be followed by Honorable Mtetwa. It's just two hands that want to speak in that sequence.
No, Chair, thank you. It was just when Northwest was responding, you spoke a lot about the private vets and struggling to get the reporting or whatever. So I just was wondering, on state vets, when FMD started, how many did you have and how many vacancies were there, and are they now all filled or are you still short? And then somebody just SMS'd me something. Now, I'm not sure if I pronounce it correctly, but I know the area quite well. It's the Bojanala Platinum District. Am I right? That's Moretele, Madibeng, Getling Rivier, Rustenburg, Moses Kutana next to me. Yeah. Somebody just sent me a message to ask, apparently there is no vaccinations. If so, why not? And is it true that it will be there by this week? I just got a message from somebody in Northwest.
Honorable Mtetwa.
Thanks, Chair, and greetings again. Mine are three for Gauteng, Northwest, and DG. For Northwest, in Macau-Nyan is an area almost closer to Pretoria or Gauteng. The Bapong community. The interesting scenario there, the reason I'm raising it, it is the kind of ownerless and derelict mining arrangements in that area, yet there are people which is a traditional authority. Now, the conundrum is this one, is that the illegal mining activity that happens there is done by white miners. They blasting. When they have to blast, they move the community outside the blasting area. That include animals as well.
which then disrupt the agricultural arrangement. Your water table are affected, and then your dairy farming, all the value chain of farming is affected by the activity of blasting, which causes people to move and animals to follow suit. But now when you want to challenge whoever that is doing this activity, you find that it's an illegal mining operation, so which means you don't have an authority that is responsible. And then two, the Babong are also seeking their recognition in that space. So which means it is not yet in their hands to account for that land, yet it is in their name. Then the disruption of a life. So in that kind of situation, it needs you, MEC, because we were going to experience an FMD outbreak in that area perhaps because of that arrangement. And then for Gauteng, as you do inspection with the police, given the Madlanga Commission behavior of police in Gauteng, to be specific, under crime intelligence, how much of stock theft related activities could we link to the mismanagement of policing in Gauteng? Now that you are even working with them, can we trust that their intervention may not be actually affected by their behavior, because it looks like a laissez-faire kind of arrangement in the policing setup as we speak? So working with them, they could be also scoring own goals where they allow stock theft into Gauteng, and then it leads to FMD because we have an issue of managing police and their behavior there. So that's an issue. Then for DJ, it is now interesting for you to monitor the application of this judgment of Sakelika. Why? It looks like the interest is personal, individual, white farmers. Now, here's the conundrum. There is a likelihood the state is fighting for procurable stock from abroad. Now you have individual white farmers who want to procure individually from abroad. And yet the same white farmers are sitting in the statutory arrangement where these things should be jointly done. But they are fighting so hard that they must have individual rights. This is what is going to happen. There's going to be depletion of stock abroad where it is being procured. Then they'll be sitting doing what we call in economics hoarding of stock after procurement. And they hoard the stock to frustrate the state from getting stock, and then stock must be procured from them at the highest price just because of this judgment. This is a red flag, and we should monitor it. That's why I was interested when the MEC from North was saying that they are the worst reporters. I like the worst reporter idea because it's now clear the motives and the drivers and the interest is profit maximization at the expense of FMT. Thank you.
Do you want to make some few comments? Or MEC?
No, Chair, on the question of the vaccines in Bujanal, the availability will deal with, but Moritile is fully vaccinated. And Moritile is clear. It may be some parts of Moses Kotane because it has more rural communities than any other area in the province. And of course, very difficult to travel in between. He will tell what is going to happen. Now, Bapong and illegal mining, again, this one, it's not an issue to be related to vaccination only. It's a question on the future of agriculture. Because mining is creating a crisis on availability and stability of agricultural land. Now, quite often, we even have what I term legal mines. Because in your farm, which you've been operating, just tomorrow you get a person with a license of exploration, former deputy minister, saying, I've been approved for exploration, I'm requesting access in your farm. And it starts there. As to who must be consulted between the other and one. The ones that are legal are the ones who give a notice for a blast. Illegal ones do not give a notice when they are to blast. And this is the area where Presidency has also deployed that contingency of the South African Defence Force because of the rife on the number of illegal miners. And in this instance, they use community members. They pay you to give access to few meters away from your house to dig. As you dig, they go and complain that there's a problem in their yard, but they would have paid to get access. Very complicated, but the issue that is critical, especially for a portfolio committee of agriculture, it's whether we can strive a element of peaceful coexistence between mining and agriculture, because mining gets depleted and agriculture is to feed the future. It can't be that it's mining that is dislodging, feeding the future. Yet it should be the feeding the future that determines where should mining be or not. In fact, like you have a background on mineral resources, we need to go back and make it legal explicit that anyone who applies for an exploration or a mining license should first consult the surface owner. I get it, mineral wealth is beneath the soil. Now the problem is that you are the owner of the farm. You are the last to be consulted by a person who already has an approved license, who says, I am allocated in your farm. All I need is to consult you for access because I must mine in that portion of your farm with already approved. If we could tighten that so that you first go to the one who owns the surface, and having gone to that person, then you will then have an approval. The problem with that is that a horse, and I'm sure they're going to hear to me and have a problem with that, a horse who is assumed to be owning the land, can't the land in Northwest, for instance, you get mines, you get farms. A farm is allocated to you by land reform. It's not allocated to a traditional authority. It's a farm allocated to you. But then because they know in this area is traditional authority, they go to the traditional authority to get permission for mining in your farm. Only when you come and complain to land reform, then land reform realizes that, but we allocated to you. They should have came to you first and not to the host. Those are the complications that we have. But seriously, we have a serious challenge of dislodging of agricultural productive land for mining purposes, which has a history less than 20 years. So people go an agricultural productive land for a mine of 20 years lifespan. Thank you, Chair.
Honorable Mtetwa, relating to your question about the nature of criminality and crime in this sector, I think you've touched on a very critical topic of stock theft. It is the most prevalent form of crime, of course, in the agricultural sector, and I think the element that you speak to, I don't want to necessarily confirm, but the statistics show us that 87% thereabout of stock theft is a function of organized crime versus your subsistence kind of stock theft, which is, of course, also prevalent, but it's not actually the key driver. So, and that's where, you then see the transnational but also interprovincial movement of animals. And as I've tried to really labor the point, the weakness of enforcement due to various reasons is one of the key issues that makes it difficult for us to address this issue, which is a countrywide issue. We have quite good relations, I will say, with law enforcement in our province. We work collaboratively with the different stock theft units, as well as other law enforcement units across the province. And so certainly from where we sit, there is at least a focus on this issue, which has been assisted in a way by the foot and mouth disease crisis, because we've been able to raise awareness and also do these joint operations where we are able to then assess whether people have correct paperwork and whatnot. But to the point you're making, yes, I think there's broad law enforcement challenges and weaknesses that we must all concede to. And stock theft is not immune from those challenges. Thank you.
DG, any parting shot?
No, thank you very much, Honorable Chair. I thought.
Okay, yes, before the DG.
Oh, yes, thank you very much, Chairperson, and thank you, Honorable. The issue of this allocation is in two forms. Firstly, it's vaccines that were allocated to Northwest Government. It was a conscious decision that was taken by DARP Northwest to share it with the industry. We finally got the first component correct. They are consistently reporting back to us, only that their method of utilizing vaccines is not the same as government's method. The industry that was given vaccines is the feedlot industry. They only vaccinate batches of animals as they get into a feedlot. So at any one time, there is a lot of vaccines they hoard. Sorry, wrong word. They keep. They keep waiting for another consignment to come. So for the whole time they are keeping and waiting for another, they are not going to report on it. Another category was then the private veterinarians, who are located again from provincial allocations. These we have had to flag it out because in our weekly reports, which we share with stakeholders, it appeared like there's some vaccines that we have. We would report that we've used 99% of the vaccines, but when you go down to the figures, it wouldn't tally. We wouldn't report doses that were given to private vets unless they return back to us. So we have had to come to a point where we indicate that all of vaccines that was received by Northwest has been distributed, part of them to the private vets, but they just haven't returned them back. And for that reason, we wouldn't report them as having been used. For Bujanala, Honorable is correct. MECs is correct about Moritele. It's primarily rural. We have, in fact, this week, I think the Provincial Portfolio Committee is visiting that area. They are only going to monitor or oversee the work that has been done. All areas, all villages or epidemiological units in Moritele has been vaccinated. Khetling and Moses Kotane are the ones that were lagging behind. We have had setbacks in those areas, firstly with vehicles. Unless we have mobility, this whole work of vaccination really suffers. There were issues with availability of vehicles, which was addressed at the provincial level by allocation of vehicles in those two areas. Human resource. We had people retiring, leaving that area due to personal issues, related issues. And we have also had people moving out of that area, and we had cross transfers. Recently, the last cross transfer that we received is from a colleague who came in and had to leave for maternity leave. And so for that reason, that whole area of Moses Kotane and Khetling still remains without a personnel. But in the same breath, we have there is no state vet currently there. And both Khetling and Moses Kotane, the Khetling one, they departed about a year before Foot and Mouth started. We were at the beginning of Foot and Mouth. We had a state vet who, for some reason, decided to leave also, but then we have received the allocation of RMIS, animal health technicians. Out of the 8 that was allocated to Northwest, we deployed 2 of them in that area. For a very long time, they operated without vehicles, which was a hindrance. We were working around them, in some instances, getting technicians who've got vehicles to take them to where they have to go and collect them at the end of the day. But they have since received vehicles now as of last week. In as far as vaccines are concerned, this week, in fact, by yesterday, we have received an allocation of 220,000 doses for the Northwest. They are going to be picked up today, if they have not been picked up already. Then we're going to be distributing them. With the enhanced human resource situation, we should be able to put more focus on Moritele, on Gauteng and Moses Kotane. Thank you very much. State vets, we still do not, but they have been advertised. We're in the process of recruiting new state veterinarians.
DG?
No, thank you very much, Chair. I think Honorable Mthethwa was guiding us in terms of managing the demand and supply area of work and how we can make sure that we secure vaccine supply certainty over a period of time. And I think what is raising is a real point that was also a point of discussion during the negotiations. Thank you very much, Honorable Mthethwa. I think just to wrap it up, the area that was raised by Honorable MEC Sambata is an issue that Parliament was seized with when they considered the Preservation and Development of Agricultural Land Act, which is currently just awaiting finalization in terms of regulations, which will ensure that there is coexistence between mining and agriculture. And there is that process of ensuring that agricultural land is preserved for the future. Otherwise, we are declining in terms of the number of hectares that we have under agriculture. Thank you very much, Honorable Chair.
Thank you so much, DG, MECs, and your technical team for taking us through the presentations. It is indeed, it was a very long day and it was very informative and empowering on our side as the portfolio committee. One can safely say these engagements were constructive in their nature. They are empowering both on your side as well as on our side so that we can see some of the gaps that our portfolio committee identify and also come up with some solutions around those issues that they are raising. We just want to take this opportunity for coming over to brief us on the state of affairs as far as FMT is concerned, together with interventions and implementation of the vaccination program. Tomorrow, then, we're going to start with we're going to start with the Western Cape. We're supposed to start with Northern Cape. Unfortunately, we did receive an indication from the MEC that he's addressing during the day. So we're going to start with the Western Cape, honorable members, then followed by Northern Cape, the Eastern Cape, then we're going to end with KwaZulu-Natal. So I don't want us in the morning then to be questioning each other. Why are we starting with the Western Cape and they've written to us to request that they are having another commitment, but then they want to honor this invitation. Thank you so much, DG. Thank you so much, MECs. You must then expect us to come to the provinces for an oversight to see what you shared with the portfolio committee, whether it exists or it doesn't exist. And also we'll be coming to just have a look at whether there is any improvement as far as FMT is concerned. travel safe back home. Those who are going to sleep over here, they must enjoy Cape Town. The meeting is adjourned.